brighter future for all my wonderful constituents. Mr. Speaker, to all Dominicans, both here and abroad, to them I say greetings, and I offer sincere solidarity to all of them. I indulge your permission, Mr. Speaker, going forward to refer to my notes from time to time.
Yeah, permission granted.
Thank you very much. Before I go any further, Mr. Speaker, I wish to say that I wholeheartedly support the budget as presented by Honorable Dr. Irvin McIntyre. This budget is more than numbers. It presents a forward-thinking vision anchored in accountability and strategic solutions for our people. It demonstrates that this administration prioritizes the needs of our people. The budget reflects the realities of our citizens, from inflation to global supply challenges, and provides compassionate and strategic actions. Mr. Speaker, this budget is rooted in care. I wish to say kudos to the Prime Minister, someone who offers and demonstrates every day true empathy for the people. Mr. Speaker, empathy and concern are not performative. This requires presence, purpose, and consistency, and one cannot live far away from the people to demonstrate these virtues. You cannot live in South Sudan and demonstrate these virtues to our people here in Dominica as an active leader, Mr. Speaker. Mr. Speaker, last year in my address, I referred to this as a betrayal, Mr. Speaker, as Judas's, but I was rather kind, I was rather generous, because, Mr. Speaker, like I said, compassion is not a performance, it is a calling nurtured through action. On this side of the aisle, we embody this value daily, evidence in our policies, our programs, and our actions for and behalf of our people. While the focus is our people, Mr. Speaker, the driving force behind our compassion and our policies is the Honorable Prime Minister Roosevelt Skerrit, a leader by example. His vision has reshaped the environment in Dominica and garnered respect throughout. No longer is Dominica seen as a little brother in the Caribbean or a little brother in the world. This has changed, Mr. Speaker, on the global stage. With quiet strength, the Prime Minister champions the people's cause, showing composure with every challenge and demonstrating progress with every opportunity given. With the Prime Minister at the helm, we are now not just building a nation for today, but we are certainly positioning Dominica for a resilient and purpose-driven future. Mr. Speaker, I stand here with a strong and sincere sense of responsibility as the leader of the Ministry of Health, Wellness, and Social Services. I understand the importance of fostering a nation that is well in body, mind, and spirit, and that health is vital for the lives and livelihood of the people to realize progress for this nation. Our goal is clear: to strengthen healthcare delivery, enhance supporting services, and the well-being for all. This is no ordinary task. It is sincerely an immense honor and a profound responsibility. In moments of vulnerability, when families face the unthinkable, our collective mission is to ensure that no one suffers alone and that no one feels abandoned in their darkest hours. This role requires not just administrative skills, it requires progressive and agile thinking and methodologies, but added to that, a deep sense of empathy. Mr. Speaker, every decision we make carries weight. Every action significantly impacts the lives of our people. But let me assure you, Mr. Speaker, my esteemed colleagues here in this chamber and the people of Dominica who are listening, we hear your voices, we hear the concerns, we know of your hopes, we understand the challenges faced in our healthcare system, Mr. Speaker, I recognize that while we have been doing a lot throughout this fiscal period, Mr. Speaker, I recognize that even one negative action, even one shortcoming is unacceptable, Mr. Speaker, and there always lies an opportunity for significant improvement. Mr. Speaker, I commit wholeheartedly, henceforward, to take assertive, decisive action to ensure, Mr. Speaker, that we continue to foster services in an environment of compassion and excellence to bring forward better healthcare outcomes to our people. Mr. Speaker, primary healthcare services. This is delivered through 49 health and wellness centers throughout the country. In the last fiscal period, we saw 52,683 patient visits. So basically what I'm saying, it's not necessarily people, but visits in this case. 2,803 clinics were held, 361 community health promotion activities were held, 2,320 antenatal clinic visits. We had 884 home visits. But Mr. Speaker, while these numbers have increased from the previous fiscal period, I wish to say that our numbers, our vision, our objectives, it's not fulfilled by merely looking at statistics alone. You see, we wish sincerely to encourage and ensure that we motivate and encourage people to use our healthcare services, our primary healthcare services, Mr. Speaker, as a preventative measure. We wish to foster an environment instead where we don't only heal the sick, Mr. Speaker, but that we can measure a stronger population or a stronger healthcare service by diseases prevented, Mr. Speaker. NCDs managed, families strengthened, Mr. Speaker, where health education is in the mind and the hearts of our people, Mr. Speaker. Mr. Speaker, we've had quite a few public screening programs throughout the last period. We have adopted that on-site approach where we bring health, we bring the checks to the doorsteps of various businesses and communities, Mr. Speaker, to ensure that there is greater access, visibility, and equity. And we have seen significant improvements in access to our services. We have seen that through various screening programs, we have offered this to government officials, public officers throughout our service. We have had, our first screening for public officers where 60 employees within the public services utilized this screening opportunity with 15 referrals to urgent care. We also provided and offered services with our nutritionist, dietitian, and so on to offer advice as it relates to nutrition and exercise. In our second screening, we had 52 participants within our public health space, with a reduction now 7 referrals. Recently, on April 16th through the 17th, we had another opportunity on the Bayfront where we collaborated with the Ministry of Youth, Sports, Community Development, where we had over 128 participants, including public officers also, Mr. Speaker. And this is noteworthy, and we're definitely seeing an improvement in the vital signs and statistics of public officers, which is good. Specialist referrals reduced to 8 in December, Mr. Speaker. And a lot of that can be attributed to the active decisions and opportunities that we are creating for improved wellness. And I'm speaking to the opportunities for exercise that is done through the Cabinet Secretariat's office collaborating with the Ministry of Health. And that includes opportunities with Ms. Higana Dorival and also Alex Laville and Jolly's Pharmacies and the pharmacy and the various initiatives that we're having for public officers within this service. Mr. Speaker, in April, we collaborated closely with the parliamentary representative of the Cottage constituency, where we had quite a successful health fair. Kudos to him for that. And we saw tremendous participation in this. And, you know, this is good, not only for our statistics and to establish baseline data for our ministry, but it's a wonderful opportunity for engagement and to speak to our people and educate them on preventative care, Mr. Speaker. And I encourage all of the other parliamentary representatives to do the same. The Ministry of Health, Wellness and Social Services stands ready to have various health fairs and screenings throughout this fiscal period. Mr. Speaker, maternal and child and adolescent health. This is very important for us, Mr. Speaker, and I wish to make it fundamentally clear that maternal and child health services are provided free of charge to our people, to all women across the island. And many women, we have observed, access antenatal care services quite late, and this results in many cases in poor outcomes. And this is something that we would like to see changing in this period. Mr. Speaker, we have seen that during this reporting period, we have had 365 deliveries, basically representing 1 delivery per day in Dominica. In that period, sadly, we've had 1 maternal death, and we've initiated an independent investigation by the Pan American Health Organization to ensure that we learn from this particular situation. A total of 278 women access antenatal services, with 99.2%, almost all of them accessing the services, basically having 4 visits, meeting the WHO standards. Mr. Speaker, we have also initiated in the past year adolescent-friendly clinics launched in each of our 7 health districts, where we have focused clinics and attention just for adolescents, Mr. Speaker, and that is sincerely noteworthy. Nursing. Mr. Speaker, nursing is the cornerstone of Dominica's health system. Nurses are effectively at the front line of our well-being. And in Dominica, nurses form the largest group of professional healthcare providers. They comprise of a significant part of our workforce. In that period, Mr. Speaker, we have focused tremendously on nursing and our nursing services. 27 new nurses were recruited, 22 of them were assigned to the Dominica-China Friendship Hospital, and 7 were retained within primary health care. 10 highly skilled retirees were re-engaged contractually. 10 Cuban-trained nurses joined the fraternity. And we thank the Republic of Cuba sincerely for their collaboration over the past few years, Mr. Speaker. This has significantly augmented and added significant value to the delivery of care and our outcomes in Dominica. So thank you, Ambassador, and please convey our gratitude to your country. Mr. Speaker, notably, while we have heard of issues of nursing attrition, this year, by the strategic investment, by the focused attention that we have placed on our nurses, we have seen a 100% reduction in nurse resignations and migration during this period. To improve staff morale and commitment, several initiatives were implemented. Permanent appointments for 79 nursing personnel, a record number, Mr. Speaker. 4 public health nurses completed advanced training. 32 public health aides received contract renewals. 17 nursing aides were confirmed into permanent roles. And for the last here on average within the Ministry of Health, Wellness and Services, every week we basically appointed 2 new people. Mr. Speaker, this is a government that cares. This is a government that is people-centric. This is a government that provides opportunity for upward mobility for people. And I stand proud to be part of this distinguished Dominica Labour-led government administration. Mr. Speaker, various professional development workshops were held during this period. We saw many covering leadership, maternal and childcare, disaster preparedness, ethics, and I say it again, ethics, customer service, and performance appraisals, Mr. Speaker. That is the type of focus and strategic leadership that we have had during the year. We recognize our challenges, we recognize our shortcomings, and we're doing all it takes to address them head on. And we continue and commit to doing so. Progress has been made in strengthening the governance and regulatory framework for nursing in Dominica. We have seen the cabinet-approved restructuring, which was spoken about, and this has brought about improved morale and confidence and security for nurses, where the issues of their pathway and security has been clarified. Mr. Speaker, the Nursing and Midwives Professional Bill is approved by Cabinet and will be soon brought forward to the House. General Nursing Council has been reconstituted for the next 2 years, Mr. Speaker, where they continue to oversee standards, and there has been increased collaboration with nursing education institutions, and that has been embraced by the nurses, particularly with the continuing professional education that they have been receiving, and we have been seeing value and increased and improved outcomes from that. Mr. Speaker, we have had many opportunities to recognize our high performers, and all of these strategic approaches have been adopted to ensure that we retain, we recruit, and not only that, we highlight the high performers so that others can pattern on these models, Mr. Speaker. We've had the Continuous Professional Development Awards, arranged and organized by the General Nursing Council, where there's a basic requirement in some cases for nurses to complete 30 hours of continuing professional learning, and for some specialists, 60. We had to recognize a young nurse, and may I just call her out, Rhonda Ismail from Mahaut, just so happens to be my constituency, who was a highlight, Mr. Speaker. While the requirement for her was 30 hours, this young nurse completed 260 hours of professional development, Mr. Speaker. We had a hospital award ceremony showcasing exceptional work and reinforcing the type of culture and excellence that we want all to aspire to. Just last month, we had the Nurse Manager and Leadership Awards, where we honored those nurses fostering and highlighting and demonstrating excellence, Mr. Speaker. And that is certainly noteworthy, and we hope by us honoring them that they can also impart the skills and that managerial approach and that excellence, and ensure that it trickles down to everyone on the various teams. Mr. Speaker, overall, the nursing service in Dominica is stronger than it was last year. It's a more adaptive workforce than the previous year, but there's room for improvement to better serve the people that we represent. Mr. Speaker, we have been doing our part as a government to honor, to award, to increase salaries from 6 to 12%, to improve the environment, to ensure their stability, to give them hope and an opportunity to recognize the Dominican dream, Mr. Speaker. But while we are doing that, and we continue to do so, Mr. Speaker, while they receive awards, honors, and accolades, I ask that we be more accountable to the people in this fiscal year. And I speak to the people, the taxpayers of Dominica, the vulnerable people who, in some cases, come to our doors, come to our facilities in such vulnerable states that they themselves can't even communicate their fears, their challenges, their concerns. We have to be their eyes, we have to be their ears, we have to feel for them, show empathy and absolute compassion. This is the Ministry of Health, Wellness and Social Services that I foresee in the next fiscal year. Mr. Speaker, the dental unit has made significant advances as well, and that is noteworthy. We have seen 7,285 patients in that time period, 4,900 of which are adults and 2,300 children receiving vital treatment. They have been working. Half of that number represents people who have access to our services for preventative care, Mr. Speaker. And we're seeing also, Mr. Speaker, that for the adults receiving the preventative care treatments, Mr. Speaker, that number is about 2,498. 1,352 fillings, 1,242 extractions, while children had 1,959 preventative care procedures, Mr. Speaker, with 1,066 fillings, 439 extractions. Mr. Speaker, while these numbers represent some type of balance, we would prefer to see instead that all of these patients accessing our services were only for preventative oral care and hygiene. Throughout the 2004-2005 period, Mr. Speaker, the Environmental Health Department focused heavily on enhancing public health functions through consistent monitoring, inspections, and regulatory oversight, Mr. Speaker. And I speak to areas of oversight in food safety, waste management, water quality, vector control, and environmental sanitation. Mr. Speaker, we have found that from our supermarket audits that there are some products that were sourced from unregulated local vendors. And in response, to our senior environmental health officers would have led food safety surveillance initiatives focusing on these unregulated suppliers and sectors, Mr. Speaker. Some key accomplishments would have been 52 inspections to various poultry farms around the island, where we're able to effectively do training and education initiatives for corrective actions where deemed necessary. We're able, Mr. Speaker, to meet with 98 agro-processors, Mr. Speaker, to ensure that the food on our shelves, Mr. Speaker, and that which is exported is of high quality, safe, sanitary, Mr. Speaker. And I want to applaud the Ministry of Agriculture for collaborating in this initiative, Mr. Speaker. We take food safety and security as a priority in Dominica. So thank you to the Minister and Ministry of Agriculture. Another important milestone that we have had is reestablishing and restoring our environmental health laboratory. This is also noteworthy, Mr. Speaker. This is tremendous, and now we have more control and oversight of the daily testing that is being done. And I thank the Ministry of Finance sincerely for making funds available to restore our lab completely for testing. We are very excited to collaborate with the Ministry of Agriculture again, and soon we'll come forward to this House to present and hopefully pass the food safety and security bill, which will effectively secure and strengthen our ability to surveil and to monitor and to ensure that food security is definitely addressed in a more profound way in Dominica. Mr. Speaker, as it relates to a health information unit, a very important arm of the ministry over the past 2 fiscal periods, our unit has made significant advancements in public health surveillance. We note that there's been a reduction in the prostate cancer burden here in Dominica. In 2023, prostate cancer deaths fell by 19% from 32 to 26, with new cases dropping to 7 in this period, Mr. Speaker. And this can be easily attributed to the improved screening that we have been having in this period, Mr. Speaker, where so far we have screened through various programs 322 people. I wish to highlight also the Honorable Prime Minister, well, in this case, the power rep of the Vikas constituency, who often has a men's clinic in his constituency. And this has seen tremendous success, and I hope other power reps too can pattern on that. Again, we, the Ministry of Health, we are here to support. We have had 3 outbreaks in the last period, Mr. Speaker, where we've seen hand, foot, and mouth, dengue fever, and gastroenteritis. It is noteworthy that there were no fatalities, 0 fatalities from these outbreaks, Mr. Speaker. Hand, foot, and mouth, we had 222 cases, dengue, 465 cases, and gastroenteritis affected 1,679 individuals. Mr. Speaker, in this particular case, we noted that rotavirus was identified as the primary cause of gastroenteritis. The HIU published for the very first time, Mr. Speaker, a comprehensive national mortality report, and we saw a decrease in the crude death rate from 10.9% to 10.38% per 1,000 population in 2023. Key causes of death included cerebrovascular disease, hypertensive disease, and diabetes. Mr. Speaker, we've seen that right now there has been a transformation of the way in which we do disease surveillance, where we are much more digital in our approaches and our methodologies. All our type 3 health centers within each region, Mr. Speaker, as well as the accident and emergency department, now utilize real-time electronic syndromic surveillance systems. So basically, it is real-time, and this is important. It's important for decision-making. Dominica improved its compliance score under the International Health Regulation from 61, which was slightly below average, to 70%, which is now above average, Mr. Speaker. And this is a global score, Mr. Speaker. It's not something that we develop on our own in the corners of the Ministry of Health, Wellness, and Social Services. Every country is scored, Mr. Speaker. And we are now above average. This is the work, and this has been the focus of this ministry over the past year. Mr. Speaker, NCDs. Despite these noteworthy and measurable improvements that you've heard, NCDs still remain a threat. There's no question that this crisis sadly continues, accounting for 3 out of 4 deaths globally, and we are no exception to this in Dominica. Mr. Speaker, it is unfortunate that we have not been seeing this as a crisis here in Dominica. A crisis the way we saw COVID, likely because this was infectious and NCDs are not infectious, but it's a looming and existential crisis, Mr. Speaker, and we must all take it personally and address this head on. Mr. Speaker, just last year, based on our numbers, we're seeing for diabetes, the estimated cost of treatment ranges over the past 2 years, actually, anywhere from 16 to 27 million US dollars for people. And in the case of hypertension, Mr. Speaker, over the past 2 years, about 780,000 to 1.1 million US dollars. It is expensive. Just imagine the burden on an individual, on families. And in many cases, Mr. Speaker, we have people with comorbidities where they have both, or they have even more. Diabetes, pressure as we call it, and cancer. Just imagine the strain on families. Life-changing. For every crisis, there must be swift, decisive, measured, and assertive responses. And Mr. Speaker, our idea is to embed health and personal responsibility into the hearts and minds of all our people, into the hearts and minds of the community, churches, schools, leaders, every Dominican, Mr. Speaker. This is our approach. And going forward, Mr. Speaker, we'll be taking this approach with various initiatives that are community-based, collaborating with the ministry. Mr. Speaker, Healthy Village Initiative, communities leading the change. We'll see the ministry launching an initiative where we have various active hubs, turning communities into spaces that promote exercise and well-being. To promote walking, Mr. Speaker, no smoking zones and community gardens, wellness areas embedded within our communities. Mr. Speaker, we have another initiative, RX for Health, a new prescription for the well-being where doctors, nurses, nutritionists, and so on will prescribe differently. So no longer is it just Tylenol or paracetamol, but we can prescribe exercise and prescribe a balanced diet, Mr. Speaker. And this is the approach that we look forward to fostering and promoting going forward. We have another initiative called Wellness on the Move, Mr. Speaker, where there will be mobile NCD clinics and pop-ups for health during various communities, workplaces, churches, population centers, where we offer vital screening at your convenience. Because not everyone has necessarily the discipline or even the time to access health services. We will be coming to you. Fit for Life Digital Challenge, Mr. Speaker. We know what world we live in. It's a tech world, Mr. Speaker, technology-based. And we would like to incorporate technology for the millennials and the Gen Zs and the Gen Alphas, because we want to encourage a culture of health. But in order to do so, we can't use primitive measures and approaches, Mr. Speaker, to do this. We must be in touch with the people and use different modalities. And this is what we will be doing. Counting calories, Mr. Speaker, tracking exercise and walking and using a platform in which we can do this and measure this. And not only that, but promoting collaboration and to some extent competition. Yes, I'm seeing your watch, Dr. Henderson. Yeah, you're probably on 1,000 steps this morning already. if you walk from Granby to there, maybe more than that. Well, Mr. Speaker, this is what we will be doing. And mental health, safe spaces, and school buddy systems, Mr. Speaker, because mental health is a challenge for many. Healthy cooking, roadshow, nutrition, with a local twist. Interesting. Active school and workplace toolkits, Mr. Speaker, because health must not only thrive within the ministry, it must thrive in schools, in workplaces, churches, everywhere, Mr. Speaker. And also, too, we will have a very interesting one, and for those who like church, get ready to hear different sermons and homilies, because we'll be meeting with pastors and priests also, and letting them know their role of also speaking on health issues, Mr. Speaker, because they are leaders and they play a vital role in promoting health and wellness also. And also, we'll have youth-led campaigns where our young voices, our youth, will have the opportunity to have big impact, maximum impact in health. And that is very important. And we'll be doing this in various ways by maximizing the use of social media, TikTok, Facebook, Instagram, and having various competitions, Mr. Speaker, where we encourage them to bring forward their bright ideas that could help us in promoting healthy decisions, Mr. Speaker. And that is what we're doing, Mr. Speaker, to empower the youth, the younger generation, to ensure that there's maximum impact and participation in governance and leadership, Mr. Speaker. We also have a very interesting initiative called the Red Hat Green Check Initiative. And we are well on our way with this one, and will soon be launched. Red Hat Green Check. Unfortunately, with the colors, there's not much space for blue. I tried my best, but that is what I could come up with, the Red Hat Green Check. Yeah, I know my partner Paris is saying I give no shots, and that's my first shot, but yeah, but, but the sky is blue, but it's not a health color. But Red Hat Green Check, so basically red is synonymous with good health, the hat, and green synonymous with organic, in some cases local, vegan, and so on. So, Mr. Speaker, what we'll be doing is collaborating with various food vendors and restaurants and so on around Dominica, collaborating also with the Ministry of Tourism, which we have started doing also. And what you will see on various menus going forward is there may be a red hat or a green check next to various items, demonstrating the endorsement from the Ministry of Health, Wellness, and Social Services. And that, I think, is a forward-thinking initiative that will benefit many of our people. Mr. Speaker, the National Drug Abuse Prevention Unit and Health Promotion Unit are key to advancing public health education and addressing NCD concerns in Dominica. Much was done in the last period from these units, Mr. Speaker, where we saw the utilization of Kahoot quiz, Mr. Speaker. It's basically a game-based learning platform where we're appealing to our youth to have them engaged, Mr. Speaker. In March, we saw a peer helpers education program for our grade 4 students that was launched successfully so, Mr. Speaker. And we saw many of our officers visit various schools around Dominica. Also noteworthy, and I know on the member for Grand Fort Riviere Cirque will be happy that we chose her constituency. So we actually went to a gas station where we had a campaign where we encouraged people to be responsible with their drinking, Mr. Speaker. And these little initiatives make a difference, Mr. Speaker. Approximately 200 health education sessions were held around the island, and we will continue to do so throughout the year. Mental illness must be viewed with the same seriousness and urgency as NCDs. And this shift in perception is essential. Mr. Speaker, as a society, we must collectively grasp the gravity of mental health and the far-reaching impact on individuals, families, and our people. We will fall short, certainly, if we don't respond immediately to the mental health needs and challenges of our people, especially our young ones and young adults. It is heartbreaking, Mr. Speaker, when I visit the APU. Just 2 weeks ago, I went there on a Monday morning. That's when they do their grand rounds. And here am I, Mr. Speaker, in a space where there are 25 mostly young men, children, fathers, people with hopes, dreams, and potential, mostly affected by substance abuse. Imagine that feeling, Mr. Speaker, to see someone I went to school with, and almost in a stoic manner, with little emotion. I'm not intending to be funny, but saying, Casso, I want 2 Domino's biscuit. It is not easy. or to have 15 females, Mr. Speaker, mothers, daughters, people with hopes and dreams, Mr. Speaker, affected by mental health challenges. This is a crisis. It is heartbreaking. Mr. Speaker, this is what Dr. Wallace and her team are faced with and deal with every single day. This team at APU deserves not only recognition, but deep appreciation for the hard work that they do. And this is why we continue to provide support to them to address this crisis, Mr. Speaker. In the last period, we have adopted a holistic approach in terms of dealing with and addressing mental health. We've had regular psychiatric clinics, Mr. Speaker, a series of inclusive moral boosting activities, ongoing training, Mr. Speaker, to include refresher courses. We've had physical upgrades to the unit, and we need to continue. Mental health awareness has been increased and elevated, Mr. Speaker. Mr. Speaker, of particular note was World Mental Health Day 2024, which featured a week-long campaign themed, "It's time to prioritize mental health in the workplace," Mr. Speaker. We've also seen training for adolescent substance use treatment in Greece and the WHO quality rights training in Barbados, further strengthening Dominica's mental health response with global best practices. Mr. Speaker, we have invested in training our people to address this existential crisis. Mr. Speaker, we have to take deliberate and purposeful action in dealing with this challenge. We are completing a mental health gap analysis at this point, and this is in view of reviewing our policy, Mr. Speaker, in terms of how we approach mental health. In our initial findings, we are seeing that it is important to decentralize mental health. It cannot only be done at APU. It must be done at homes, in the communities, churches, workplaces, Mr. Speaker. We all must be trained, Mr. Speaker, as Dominicans, as compassionate people, as people with empathy, Mr. Speaker, to see the signs. And not only to see the signs, but to take action, Mr. Speaker. Mr. Speaker, we must move past from that notion, Mr. Speaker, where everyone tries to be a social media sensation. And we tend to think that bullying is okay. How can we, when we hear a young man commit suicide, say, "Hélas, poor pity, I never knew he would"? But instead, we are the ones on Facebook being trolls, laughing at a young lady who maybe for the first time in her life wore heels to a graduation ceremony because her focus has not been on fashion all her life. It's been on education and improvement of a circumstance. And we're laughing as grown people, grown adults. And this is going viral, and good things are happening in this country, in the lives of our young people, and that's not going viral. We must take a step back, Mr. Speaker, before it's too late. This is our personal responsibility as it relates to mental health in Dominica. Don't leave it up to Dr. Wallace. Mr. Speaker, I applaud various initiatives that we have had throughout the year. I must highlight some young men who call themselves boys to men, and I will call them by name: Dylan, Sheldon, and my constituents, Terje, Shervin, and also Dr. Victor Shannon John Jr., Mr. Speaker. Boys to men. And I highlight them because they hosted the first inaugural forum on mental health for young men just recently, at which Honorable Philip Rowe was actually a speaker. And it's in these interactions, Mr. Speaker, that you really find out what is going on. It's not a high-handed approach where you're schooled. It's one that involves participation and personal stories and reflection. And this team, Boys to Men, will be part and parcel of our mental health campaign and drive throughout this fiscal year. I must also highlight one of the representatives of BWP who approached the Ministry of Health, Wellness and Social Services to offer participation and collaboration on suicide risk training, Mr. Speaker. And I emphasize these initiatives because, like I've said, mental health is a collective responsibility, not just the responsibility of the government. We cannot afford, Mr. Speaker, to play with this opportunity to address this head-on, and we remain committed to addressing this issue fervently throughout this year. Mr. Speaker, the underpinning of many of those initiatives, Mr. Speaker, we must have the right staff, right resources, training, equipment. And we've had to have various investments in our ministry throughout the year, Mr. Speaker, to ensure that our facilities are fit for purpose. We have invested heavily with laboratory equipment, spending over $169,000. We've made a final payment for healthcare waste management system consultancy, amounting to $53,000. Phase 1 consultancy for health center retrofitting has been done, $350,000. And Healthcare Emergency Operations Center has been set up, costing $308,000, Mr. Speaker. Going forward, $231,000 will be allocated for operating and maintaining services, focusing on repairs, plumbing, and so on of various health and wellness centers, Mr. Speaker. And that is noteworthy. Mr. Speaker, the work of the ministry extends to secondary care, and our efforts in conjunction with the Dominica Hospital Authority continue as we strive to offer quality health care for our people who come to the hospital. Mr. Speaker, I am a Minister of Health, Wellness and Social Services who's on the ground. When I visit the hospital, and that is pretty often, may I add, I interact with people. I touch base. I go there frequently to visit my constituents at various wards. I interact with not only nurses, doctors, and specialists and the administrative staff, but the plumbers, the drivers, the staff at APU. I interact with the domestics, the cleaners, the cooks, everyone, Mr. Speaker, the carpenters, the pharmacists. And I'm saying this to say, Mr. Speaker, because of the over 600 staff that we have at the hospital, over 600, everyone in some way is connected in our small Dominica to either staff, a patient, someone who comes to the doors of the Dominica China Friendship Hospital. Mr. Speaker, it is our hospital. It is not my hospital. It's not Skerritt's hospital or Labour's hospital. It's our hospital. And it is time, Mr. Speaker, that we take collective responsibility for what is ours. During the period 2024-2025, the Dominica Hospitals Authority successfully finalized its strategic plan for 2023 to 2028 with a clear mission, vision for guiding principles in 6 strategic areas, which I will name. This includes strengthening stewardship and governance, continuous quality and safety improvement, expanded allied health services, more effective communication and collaboration, improved management of resources, enhanced information systems and research. Mr. Speaker, this roadmap is clear. one that fosters greater accountability and responsibility and excellence, Mr. Speaker, at our facilities. To support this, we have appointed an accreditation coordinator who was able to lead in key developments, particularly for standard operating procedures, Mr. Speaker. SOPs are aligned with international best practices and are assessed by Accreditation Canada, Mr. Speaker, who completed a report first to guide us in 2023. And this addresses major areas including leadership, ambulatory and emergency care, inpatient and critical care services, diagnostic imaging, medication management, surgical procedures, and more. Mr. Speaker, quality of care and organizational culture, a significant part of our operations at the hospital. Mr. Speaker, 50% of our staff have received training, Mr. Speaker, in giving better quality care. We have been responding to what we are hearing. Mr. Speaker, in January of 2025, a quality manager was appointed, and this has led to noteworthy improvements in terms of investigations, reporting mechanisms, and patient-family engagements, Mr. Speaker. We have incorporated new feedback tools such as satisfaction surveys, Mr. Speaker, where we are seeing continuous improvement, Mr. Speaker. Expansion of services and access to care. Mr. Speaker, we have seen the establishment of new services in various areas expanding our regime of care. And I speak to anesthesia, cardiology, radiology, vascular surgery, neurosurgery, urology, and ophthalmology, Mr. Speaker. And I must note that in most of these areas, our local, homegrown people, Dominicans, Mr. Speaker, Jean Dominic, Mr. Speaker, are the ones providing that care as specialists. Mr. Speaker, in terms of key outcomes, we are seeing that 5 new urology services were offered in 2024. The hosting of 40 vascular surgery clinics, Mr. Speaker, and 38 procedures performed, and a reduction in our amputation rates in Dominica. In neurosurgery, 388 patients were seen, over 46 clinics, with 6 neurosurgeries conducted between October 23rd and December 2020. Neurosurgery. And that is just between the periods of October 2023 and December 2024. We commenced nutritional counseling, Mr. Speaker, where we reached 851 patients. Never before has this been done, with 42 meal plans developed for various people who have come to our clinics. In cardiology, Mr. Speaker, we are seeing that we have had our first cardiac MRI with contrast done, along with 12 transesophageal echocardiograms and 5 standard echocardiograms with contrast, Mr. Speaker. Mr. Speaker, all under this administration, Mr. Speaker. Never before have we seen this in healthcare in Dominica. Mr. Speaker, we have also improved collections. Healthcare comes at a very high cost. I have said before, Mr. Speaker, if this bottle of water costs $3, Mr. Speaker, you add medical grade to it, Mr. Speaker, it is now $4,000, Mr. Speaker. This is what we are contending with. Just add the word medical grade to it, and this will be the cost. That's the cost of care, Mr. Speaker. And Mr. Speaker, as a result, we've had to improve our revenue collections, Mr. Speaker, to ensure that we're able to finance and operate a hospital that is capable of delivering high care, high quality outcomes. The truth is, Mr. Speaker, while one might say Dominica is small, Dominica only has 70,000 people, Dominica this, Dominica is that. When it comes to healthcare, Mr. Speaker, there's no compromise. We have to go to GE and Philips to buy our fluoroscope fluoroscopy machines. We have to go to GE and Sony and so on to buy our MRI, Mr. Speaker. There's no aftermarket, there's no compromise. We have to pay the thousands and in many cases millions. And also too, Mr. Speaker, to maintain, we have to have maintenance contracts with particular specific contractors who are trained to manage this equipment. So while we have our own maintenance staff, Mr. Speaker, we can't just go into it and fix it how we want because this affects warranty. So even our interventions have to be guided, and this comes at a high cost. So we have had to increase our collections, and we have done so, Mr. Speaker. We have invested heavily, Mr. Speaker, in various equipment for the hospital over the period. We've purchased a new washer, a new dryer, Mr. Speaker. I was there last week. We also have challenges with some others that we wish to repair soon or possibly replace. And that's by being on the ground that you see these things, Mr. Speaker. We've had investments in a new sterilizer, a reverse osmosis system for the CSSD, colonoscope and endoscopy for gastroenterology, Mr. Speaker. This area has seen investment in equipment, Mr. Speaker. A neurosurgery head clamp was purchased in the period. A lot. New compressor for oxygen plant, Mr. Speaker. We went through a difficult period where we had a challenge, where we actually had to buy from private sector oxygen amounting to $50,000 per week. This is what we've been going through, but it has been addressed, Mr. Speaker. We've also seen the participation of private sector groups and grant organizations and so on giving support, where we've been proud to receive and privileged to receive a $400,000 USD grant from the Maria Holder Memorial Trust. And Mr. Speaker, that is significant. So while it's easy to say Ministry of Health did not draw down on this, draw down on that, Mr. Speaker, that is what leadership is about. Finding ways, creative ways, being agile and applying these methodologies to do well and to excel. We're not merely here, while it's important to budget, Mr. Speaker, only relying on this one source, Mr. Speaker. We have to find ways and solutions. And that's why we are pleased to receive this significant donation of $400,000 US. Mr. Speaker, and this now allows us to create an operating theater, Mr. Speaker, what we knew as our crash room. When a patient comes to A&E in a critical state, what you've seen in the past, Mr. Speaker, was that we had mobile x-rays and equipment that would have been brought in, Mr. Speaker, but now we will have our own equipment, Mr. Speaker, stationed in this crash room, Mr. Speaker, so patients will not have to be transported, Mr. Speaker.
Honorable Member, I'm sorry that I did not tell you that your time was close, but you just have 1 more minute in your normal time.
Mr. Speaker, I beg to move the motion that the Honorable Minister of Health be given 20 more minutes to continue his presentation.
Seconded, Mr. Speaker.
It has been moved and seconded that the Honorable Laville be given an additional 20 minutes. Those in favor? Those against? The ayes have it. Honorable Minister, you are given an additional 20 minutes.
Thank you, Mr. Speaker. Much appreciated. Unfortunately, I must apologize, but I've been looking at this clock and it's not working, Mr. Speaker. So I trust
Someone pointed it out to me this morning, but I have a clock there.
Okay.
Yes, yes.
Thank you, Mr. Speaker. Mr. Speaker, our operating theater will allow for swift surgical intervention, Mr. Speaker, in this crash room. And we will have there stationed a C-arm machine, Mr. Speaker, and a $200,000 equipment, Mr. Speaker. So now our orthopedic surgeons, Mr. Speaker, can use this while doing various emergency interventions, Mr. Speaker, by using images, real-time fluoroscopy, Mr. Speaker, so they can refer to it real-time. No one has to be moved until they're taken to either the ICU or admitted, Mr. Speaker, at various wards within our healthcare setting. Mr. Speaker, for eye surgery, we saw for the very first time with a partnership of medical mission where in a period of just 10 days, we had 80 surgeries, life-saving, in some cases, life-changing eye surgeries, Mr. Speaker. Me being there, I met with a man who had cataract to the extent that he could not see. You could not see his eyes, Mr. Speaker. And just one day after, he could see in one. The next surgery was done the following day. He could see in both, Mr. Speaker. I won't call his name. Mr. Speaker, also too, we've been making milestones, Mr. Speaker, and tremendous headway, because in our eye center, Brenda Strafford Eye Center, we have gotten attention and we've been participating very closely and collaboratively with OECS, where, Mr. Speaker, we are being seen as being in a strategic position to leverage on our vital assets to become a center of excellence for eye surgery, Mr. Speaker, in the OECS. And that is something that we're actively working on. Even today, this morning at 10 o'clock, there is a meeting with the OECS and our ministry, as well as the Brenda Strafford Foundation, to continue advancing in this particular area. Mr. Speaker, digital transformation, Mr. Speaker. Of course, that is very important for us in our ministry, where we'll be benefited from a health management information system, realizing a $22.9 million investment, Mr. Speaker, and that is noteworthy, and it will change the way in which we receive care, Mr. Speaker, incorporating greater efficiencies where medical professionals can focus more on offering services and patient treatment as opposed to rudimentary and repetitive tasks. Mr. Speaker, in terms of clinical governance, Mr. Speaker, and training, we've seen many of our doctors, nurses, and healthcare professionals receiving basic life support training, 120 of them. Advanced life support, 6 doctors, 2 nurses, and many other training, Mr. Speaker. Even communication and training, we've been seeing that. We've seen a significant reduction in overseas transfer for our people, saving the government, the people, the taxpayers, thousands of dollars. We've seen that. Why? Because we have improved our service offering at our hospital, Mr. Speaker. This is why we are seeing that. We have established a tumor board, which is also very important, Mr. Speaker. As you know, cancer is a challenge for people. I'm sure all of us in some way know someone or related to someone who has been affected by cancer. And Mr. Speaker, what this is a multidisciplinary team of oncologists and pharmacists, pathologists, radiologists, Mr. Speaker, and other specialists who come together from time to time, at least every 2 weeks, where they discuss particular cases, Mr. Speaker, to review these cases and ensure that care coordination is done to improve the outcomes of various people, Mr. Speaker. Mr. Speaker, in this upcoming year, as you would have heard from the Minister for Finance, that there are many progressive actions that will be taken. And one of those will be the approval of improved salaries for doctors commencing August 6th of 2026. 2025, sorry, I say this again, from August 6, 2025, I stand corrected, Mr. Speaker. And what we'll see is a complete review of the offerings, the package, one that demonstrates and reflects appreciation for the services and respect. And while I won't preempt, Mr. Speaker, we will be seeing something where many people who are dabbling in both private and public health at the same time will be incentivized to the point where they will likely be returning, Mr. Speaker, full-time to public health. And from the initial stakeholder consultations with the doctors, there is interest. And we're very happy for that, Mr. Speaker. We have to be competitive if we are to keep our people. And as a government, we are committed to doing just that. So I'm excited. To note also, Mr. Speaker, just last week, all specialists within our hospital setting have been paid their gratuities. All, every single one, Mr. Speaker. We also heard of the launch of a monetary rewards program for medical professionals, Mr. Speaker, and the appointment of 9 specialists and the creation of 11 new specialist positions, Mr. Speaker. Mr. Speaker, while there's so much more to say on health, I have not started on my constituency, which is important. But I wish to thank many people, Mr. Speaker. I must thank, in a sincere way, Honorable Dr. Williams for the leadership in social services. Mr. Speaker, had I had to report on social services, I would be there all day today, Mr. Speaker. And Honorable Edwards, also for your profound support, Mr. Speaker. The Permanent Secretary, Dr. Paul, the CMO, Director of Primary Healthcare, NCD Coordinator, the SAO, and other administrators, Mr. Speaker. My Secretary, Mr. Speaker. Wow, Tasha Winston, Mr. Speaker, who represents me well, who's a good professional face, Mr. Speaker, for a minister. I'm grateful for her. Mr. Speaker, and all the supporting staff, Mr. Speaker, at the ministry, at the hospital, the CEO, her staff, the Dominico Hospital Authorities Board. Thank you. I extend my gratitude to all staff, Mr. Speakers, the doctors, the nurses, the orderlies, domestics, the cleaners, every single one. The APU techs, Mr. Speakers, I'm grateful to them. And also too, in a very special way, I also extend thanks to various partners and governments, including the People's Republic of China and the Republic of Cuba, for their steadfast and consistent support, Mr. Speaker, in improving the circumstances of our people. That is commitment. To PAHO WHO World Pediatric Program, Direct Relief, Maria Holder Memorial Trust, Brenda Strafford Foundation, Medical Ministry International, Vosh Rotary Club, CARFA, OECS CARICOM, Dominica Cancer Society, the Medical Board, the General Nursing Council, Mr. Speaker. All of these partners come together to make a difference, and the private sector also, because many times when we have our awards, they come together and donate, Mr. Speaker, to help with these awards. I am sincerely grateful. Health is ours, Mr. Speaker. Thank you. Mr. Speaker, as I transition to the Mahaut constituency, Mr. Speaker, I must first start by thanking the blessed people of this community, Mr. Speaker. My vision for Mahaut is one, Mahaut constituency is one that's deeply rooted in the collective strength and spirit of our community and its people. And together, I am sincerely committed to addressing our issues and leveraging on our strength and realizing our opportunities. I want to be that bridge, and I commit to doing just that. Mr. Speaker, the journey has not been without difficulties, Mr. Speaker, but it is one that I embrace wholeheartedly. I am genuinely grateful to each member of this blessed Mahaut constituency, Mr. Speaker. Those who help me every single day, the volunteers, the one who remind me of when the funeral is, those who arrange community events and activities, those who tell me where I need to step up, how I need to improve, Mr. Speaker. I am genuinely grateful, Mr. Speaker. We have seen many things happening in this fiscal period. The upgrade to Zaman Park, Mr. Speaker, this is something that we've seen. A lot has been done, Mr. Speaker, this time period, to commence the fencing, to build a secondary access and exit, Mr. Speaker. We've seen the lighting of this park with solar lights and also electricity, Dominic powered lights, Mr. Speaker. We've seen that, and we will continue to do so as we go forward with the collaboration of the Rotary Club on this, because they have been helpful, Mr. Speaker, in arranging and organizing this initiative. I'm grateful to them. And I look forward to seeing this place transform to be buzzing, where we have more than just the Salsa and Punch every year, but it's the premier festival destination for Ministry of Tourism and during Carnival, we can see much more happening and creating opportunities for our people, Mr. Speaker. Yeah. Mr. Speaker, we've seen the upgrade of the Eddie Tula Park. During Hurricane Maria, this site would have been used temporarily, Mr. Speaker, because of a challenged circumstance to hold materials and derelicts and so on as a response to Hurricane Maria. This has been cleaned, completely cleaned and transformed, Mr. Speaker. As you will see right now, you have a playground that is outfitted for families to have recreation and wholesome activities. And we'll continue to do this. There are 3 kiosks there that we'll continue working on that to provide business opportunities for the people of Caneville. We'll soon be developing and building on the landscaping initiatives, the fence. While we have cordoned off the area, we want to ensure that we focus more on security, Mr. Speaker, so we'll continue to do so. We have also seen the regularization of squatters in Layu Park, Mr. Speaker. We would have seen that many of the people in Layu would have been moved to build the abattoir, but they have not been regularized, Mr. Speaker. So by our actions, and I know my dear colleague, because we share Layu Park, he's the representative for one side, I am the representative for the other side, so they are lucky to have 2 power reps. Mr. Speaker, we've regularized 15 squatters, and that is noteworthy, Mr. Speaker. These are people who have moved to this area since 1970, largely from Grand Bay and Dubique and so on. And we are creating an opportunity and mounting an opportunity for them to be formalized and to own their land and own their homes, Mr. Speaker. So I am very pleased for that. Lots at Jimit, as you would have heard the Minister for Housing, they would have developed phase 7 in Jimit, and where 38, I believe, lots will be assigned, and 15 of those, Mr. Speaker, have been assigned to the people of the Mahaut constituency, and that is noteworthy. And I must say and express sincere thanks to her, the Prime Minister and the Cabinet for doing so, because while I know that in our community we have some safe lands in Caneville, Warner, Jimit, and so on, we also have our issues in areas like Campbell too. So I'm grateful that Dominica is for all of us, but to have 15 out of the 38 is really noteworthy and it's fair for our constituency. So I'm sincerely grateful. The relocation of Campbell phase 1 will soon commence. In the last fiscal period, we would have purchased 4 acres of land at Warner for that sole purpose. And Mr. Speaker, you would have seen that the land has been cleared for the roadway. The various studies have been completed by the Ministry of Lands, and we will soon commence after budget the construction of that first phase. And in our last parliamentary session, you would have seen that the financing would have been approved for that particular undertaking. I am so pleased for that. The people of Campbell, Mr. Speaker, they have been through so much. I remember years ago, my dear friend Juliet, after a severe storm event, would have lost her life, she and a child, Mr. Speaker. And I'm very proud that I can be part of that transformation in the life and the circumstances of our people of Campbell. Mr. Speaker, on a softer side, less emotional, but very profound, STEM Girls, an initiative that was initiated in our last fiscal period. We recognize that in the area of STEM, that many of our young girls and young women have not been participating a lot. So we initiated STEM Girls, where we try to get the interest of young girls from 8 to 13. And we have done a lot throughout this year. We've visited Flow, we visited the facility at 1 mile. Thank you, Minister of Agriculture, for allowing our girls to put their coats and go to this tissue culture lab to plant that seed of interest, Mr. Speaker. These are our young scientists. I'm grateful. I'm grateful to Flow for allowing us to come to them. The hospital, these are the visits. And to also teach them masonry, carpentry, block laying. For girls 8 to 13, this is what we're doing in our constituency, Mr. Speaker. Sports, I must highlight in a special way Ms. Luke, Mr. Speaker, from Sultan in our constituency, who recently secured gold for us in 400 and 800 meters, Mr. Speaker, at the Windward Island School Games held in St. Vincent. Congratulations to this young lady, Mr. Speaker. This, Mr. Speaker, is our next gold medalist. It is not by chance that the gold medalists at the Olympics come from the Mahaut constituency, Mr. Speaker. Last year, we had a summer youth music workshop, Mr. Speaker. That was quite successful. Arts and culture, it's an important, a foundational pillar in our constituency, the home of Bell's Combo and many other musical bands and groups. And we need to ensure that we create a community that culture continues to thrive. And in that regard, we held this workshop. And we had the famous Halibut and Caribbean Cowboy, people from our community, you know. And Julie Mate also helped us out in teaching them calypso writing and introduction to the guitar. So that was quite successful. Mr. Speaker, we have also supported small businesses, and we have done so directly through my good office and also through various ministries. Through Ministry of Agriculture, just last week, many of my constituents benefited, Mr. Speaker, and also through the grant opportunity in digital economy. And my role in that is to let my constituents know about the opportunities that are present and to ensure that they get their fair share, Mr. Speaker, because our people are productive, Mr. Speaker, they're ambitious, and they need opportunities. When the opportunity comes, Mr. Speaker, we knock that door hard and we push and we grab, Mr. Speaker. That's what it is. And that is the type of representation, Mr. Speaker, that I'm offering to my people. We had a successful health fair ourselves. I spoke about the one in Cottage, but ours was the biggest, where we had participation of over 130 people in the Mahaut constituency. It's the truth. It's the truth. Our number was the highest, Mr. Speaker. So, yeah. And I'm grateful, Mr. Speaker, to the Cuban collaborators for providing much needed support during our health fair. It was a collaboration between the Republic of Cuba medical collaborators and our own Ministry of Health to offer these services to our people. And this is important. Imagine having a health fair on a Saturday at Mahaut Market, a buzzing place, where you have to, in some cases, convince your brother man and your friends, that fisherman, to get your blood pressure tested. And I'm thinking of one right now that you had to convince, then eventually you had to be rushed to the hospital. These are the circumstances of meeting someone at the market and you're begging them to test their blood pressure. And they're telling you that I don't want to do it because I know it's high. And these are the things we encounter, Mr. Speaker. We've had an elderly initiative, which is noteworthy as well. And I'm encouraging all the various power reps to do the same. And in this elderly initiative, what we did, Mr. Speaker.
2 more minutes.
5 minutes.
Mr. Speaker, I move that the Honourable Minister be given a particular 5 minutes to wrap up his presentation.
Seconded, Mr. Speaker.
It has been moved and seconded that the Honorable Laville be given an additional 5 minutes. Those in favor? Those against? The ayes have it. Honorable Laville, you are given an additional 5 minutes.
Mr. Speaker, thank you very much. What I will do is arrange a town hall meeting in my constituency soon to go through all these initiatives. I wanted to highlight the elderly initiative, Mr. Speaker, because our elders are very important to us. And what we recognize that they have special circumstances, things that are unique to their demographic only. So what we did, we brought all of them together and we spoke about things like loneliness, Mr. Speaker. Can you imagine that? Or the fear of dementia. And in some cases, management of medication, where you have those taking 12 pills a day. How do you deal with that? Or you have an interesting circumstance, and I see it also with my own mother, where they want to ask you to help them with something. It could be transportation or going somewhere. But the fact that you have to work, they feel like they're troubling you and so on. And these are the circumstances, Mr. Speaker. And that's what being on the ground does, Mr. Speaker, with your people, to understand and address these circumstances. So I encourage that for all other power reps. We have the rubric and we're ready to roll it out for all of you, Mr. Speaker. Mr. Speaker, the grade 6 national assessment, very quickly, our constituency did very well, but I must highlight Warner. 9 out of the students who sat the exam were proudly successful, where we saw 3 scholarships and 1 bursary from the 9, and that is noteworthy with high quality grades, Mr. Speaker, and I must congratulate our small community of Warner for doing exceptionally, Mr. Speaker, at the grade 6 national assessment. Mr. Speaker, we will see upgrades to the Health and Wellness Center, Esprit Murphy Health and Wellness Center in Mahaut. We are at a stage where the tender process is being finalized, and soon there will be an award for a contract to upgrade, where we'll then have what is like a polyclinic, a type 3 health center, Mr. Speaker. There will be an extension to the facility, and that we'll also see in a few other constituencies. Teacher Bonnie, I know you stand to benefit from that as well too. And Honorable Grant, you will as well too, from that program, OECS regional project. Mr. Speaker, Rodney's Rock is a vital asset, and Minister of Tourism, I expect that in the next fiscal period, we can talk about Rodney's Rock. We've started consultancy, we started stakeholder engagement since 2003 with various people on Rodney's Rock. We know that there are a few proposals in place, and what we would like to do, Mr. Speaker, is to continue that conversation, because it's so close to town, and we believe that there are profound opportunities for developing that site to provide opportunities for people. Our fish landing facility, the upgrade will soon be completed, Mr. Speaker. We are looking forward to that. Yeah. And Mr. Speaker, we want to highlight just very quickly the sports teams in our community. Blazers, Mr. Speaker, are doing well, winning championships year in, year out. The Soca Strikers, Mr. Speaker, in Premier Division, our men are number 2 right now. And we were recently promoted, Mr. Speaker, not too long, and we are number 2. And the Soca Strikettes, our women team, they are number 1, Mr. Speaker. We have fantastic sportsmen and women. Even our stenographer who is in there, Miss Esprit, right there, is the medic and manager for women's team, Mr. Speaker. So we are all in, and congratulations to them for that. Mr. Speaker, we know that we've been plagued with the issue of collection of trash. While various communities have had the issue, I speak for myself. It's a burning issue that has plagued us over the years, where many times I've had to make personal interventions to ensure that our community is kept clean. And that is why I'm just so grateful for the announcements in the budget, where the Ministry of Environment is responding directly and swiftly to get more trucks. And not only that, recognizing the makeup of our constituency, the small roads to access Subuli and Formage and Mr. Speaker, Solomon Lane, which we call Mount Georgian and so on. These big trucks can't go there. So I understand they will be purchased, and Shimeko, where I'm from, they will be procuring 4 trucks, and 1 will be assigned to the Mahaut constituency, and I'm tremendously grateful for that, Mr. Speaker. So thank you, Honorable Prime Minister, for that, and the ministry. Mr. Speaker, with all these initiatives that are taking place, we will be seeing our community roads initiatives, which we are already working on, as you will see, and others. Right now, we're working on a small footpath bridge in Benawavin and so on, a road in Backstreet, providing job opportunities. And I want our constituents to reimagine the way they look at work in this new fiscal period, because with 32 lots available, many of these people will be building in Jimmet, and we expect jobs. The future housing program, which is ongoing, there will be jobs for our constituents. Phase 1 of Campbell relocation, there will be jobs, Mr. Speaker, and the various other interventions. So people need to get ready to work in this period, Mr. Speaker. And I'm grateful for the government for these strategic investments that are creating opportunities for our people. Mr. Speaker, I could say a lot more. But above all, I just want to say thanks for this opportunity, Mr. Speaker, to speak to our people. I want to express my sincere and profound gratitude to the Prime Minister, Mr. Speaker. His exemplary leadership is charting a way of progress for people and to improve our circumstance, Mr. Speaker. I appreciate his commitment in everything that he does in putting people and the progress of people first. I want to thank my colleagues in a sincere way for giving me support, Mr. Speaker. I cannot imagine working with a better team, Mr. Speaker, than these people that are in my presence. Thank you sincerely for your support. I am grateful for all of you. Mr. Speaker, I wholeheartedly support the budget as presented by the distinguished Dr. the Honorable Irvin McIntyre, Mr. Speaker, and I commit wholeheartedly to implementing, Mr. Speaker, as we move forward in this fiscal year. Thank you, and may God bless you.
Yes, permission is granted. Yes, Honorable Defoe, you are recognized. You may proceed.
Thank you, Mr. Speaker. And before I commence, Mr. Speaker, I might say perhaps the Plaine constituency and the Hansard might not be so kind to the House because the member doesn't have much opportunities to even second the motion because you cannot see me, Mr. Speaker. And so the Hansard will be full with secondment from Honorable Lloyd representing the St. Joseph constituency. But just remember, we were always in the House. And yes, I also propose that Senator Paris do some pro bono work for the House and suggest perhaps how we could eliminate this column and come with a new idea. Perhaps suspend it, Mr. Speaker, and Honorable Laville can join him in the spirit of cooperation. Mr. Speaker, I rise to give my support to the 2025-2026 budget presented by the Honorable Dr. Irvin McIntyre, the member for the Valley. I found the delivery to be quite profound, and 1.2 billion, as we grew up, I said in service, we were not used to these sort of numbers, but this is the norm of this government because of the level of investment that it has to do, and it has been doing. Mr. Speaker, I want to start with the theme. And also the theme spells volumes to what is the intention of this particular budget. It is balancing resilient development, and fiscal discipline for sustainable growth. And fiscal discipline, Mr. Speaker, I think is what we should be expressing to the Dominican public. And I say so as a father, the head of a household, a parliamentarian, a minister, and I carry that same principle for all of these tasks. And because it is time that we as parliamentarians, the ruling government who has been in party for past 25 years, to speak to the Dominican public. They have been with us for a long time. They have seen the highs, the lows, the difficult times, and I have come to understand and know these people are very genuine and very understanding, and I am very sure that when we explain why in different times things have to be different, they will support us. They will support us, I have no doubt, because I encounter them in my daily encounters. Mr. Speaker, from time to time, I will refer to my notes Sometimes I feel guilty because other people think I don't do homework. So I just write. But most times, I never say what I write. So my colleagues don't feel, I cannot write. Okay. Mr. Speaker, a budget, and in my experience as a public servant, is usually a 3-year cycle. And I come back to this is why when we're explaining the budget to the public, we do not give the notion that is a one-time thing for 25, 26, and forget 26, 27, and 27, 28. Because the figure that is usually presented is broken down over these 3 years. And if necessary, a project does not end, then after these 3 years, you budget again. And I say that to refer to a point that Senator Paris made, especially when it comes to the rate of implementation. Because the amount, when you have the total figure, and I will take, for example, coming out from the budget, that you would see the total cost, the estimated cost of the marina, which is under the portfolio of the other Prime Minister, the member for vehicles, that it costs over $200 million. But you see the allocation for this fiscal year is 43 million. I mean, there may be some things after it, but it's 43 million. So it's not the two. So you will get in the second year another amount, and different projects have different mechanisms. The specificity is different how they implement it. So you might have the budget of $1 billion, but the first year you only need to do the assessment, which is a much smaller amount than the second year when you start to really mix concrete, and the third year when you actually start to put up buildings. So I just want to say that for the public, so that they don't get the notion that a budget cycle is 1 year, and we have to rush to do everything, and we have to rush to give our constituents everything. It is a 3-year cycle, and after the cycle, you reassess. What is finished, it goes in the budget as completed, and those that are new are new. And these are, and I really, I mean, I am fiscally conservative. I have said so before, Mr. Speaker. But there is a difference between being fiscally conservative and a miser. I always differentiate that. My colleagues who are around me and so on, that is not who I am. So expressing to people that in a global environment now as we speak, and I looked at the budget, and then you would see in budgets of the past that you would see large amount of grants from the European Union, even from the United States itself, from Great Britain. And if those of us who follow the international arena and the news and international politics, you would know that the UK has now cut its international aid budget by 40%. The EU in itself, to meet its NATO mandate, which is mandated upon it with the pressure from the United States, to make its budget, its defense reach 5% of its budget, have to take it from somewhere. So obviously, the European Union, which is a traditional or cultural partner to even in terms of budgetary support, has to pull up its own weight. So you're not going to get money there, Mr. Speaker. And in the other areas in the Middle East, yes, they have money, but it's more like concessionary and financing. So we find ourselves the only true partner left sometimes that will give you a considerable grant to do something meaningful is the People's Republic of China. Right. And in the good days when our sister, our brother Venezuela, was on his feet, you would get this sort of support. So this world has become a very nationalistic world, Mr. Speaker. Yes. And we have to fend for ourselves. We have to stand on our own. And for you to do that, for you to have an experience, you have to be a man that runs in a home and know what it is to run a home. Because the very same thing that you have to do in a home is the very same thing that you have to do in government. I do not see the rocket science. I'm listening to the media a couple of days, people thinking that it's so sophisticated, these economists, and you go, well, my brother, it is very simple. And when I have sat in this room for the past several weeks, debating within ourselves, it wasn't about any specific constituency. It was about the overall and general development. Now, lucky for you if the things that have to be done ends up in your constituency. You will boast about it. It will create employment for you. I mean, you'll be like Grant. You'll be like Honorable Dr. Mark, many projects in the valley. But that is the nature of development. It's one point, one thing after the other. Now, if I had my own personal way, Mr. Speaker, my own way outside of the Honorable Prime Minister, outside the cabinet, I would focus on the key pillar projects that we have, that the state is investing in this difficult time, and see them through instead of trying to stretch ourselves thin. And this is the international airport, the geothermal project, the cable car project, the marina. Rosso enhancement already, is well baked. And let us do these things, Mr. Speaker, and let us do them well. Because the capital city belongs to us all. The airport, no matter where you're from, you have to go there to travel. And it's not just about the amenities and services, but we have all come to understand now, Mr. Speaker. The ferry terminal, I will come to it. We have all come to understand, simultaneously, because if you look at the timeline of them, they are all within 1 year and 2 years apart to be completed. So I don't find this is a hard story to sell. This is not a hard story to sell. As I said, the Dominican public is understanding. They have been understanding. They have understood this ruling government, Labour Party, for the past 25 years. Why are we getting nervous? All right? Let's have faith and hope in the people who are there, because we keep stressing ourselves about a remnant of a minority. Why? A remnant of it's not even a minority. It's just remnants of a minority who seem to spend more time, because you spend more time on social media when you have more time. I really and truly do not know what goes on. Social media is something when you at your home, you put your foot up, and you have. I have not have zero time for that. I reach home late every day, every night. I work in, go and see people on my way up. I really do not have time for it. I don't know what people say, what people don't say. I don't mind what people say. Nobody tell me say. That is not my business. I'm too preoccupied with people's work. That's it. I am too preoccupied with people's work. So, I can go on and on, because, people know me. I don't even turn a page yet, because the macro economics of the country and the projects that are now are solid. I am confident in 3 years' time, the Honorable Henderson is closing the geothermal project at the end of this year. At the end of this year, cable car is closing, and then we will get the additional funds to do the additional things. Because these projects, but we have kept all the fundamental things. We have not reneged on our social responsibility, 65 years and over. This is that we will not renege on. I don't want to talk to the NEP. I will speak to it when I reach my constituency, of the impact of these people. And all of the critical things, let's keep it and let's move on. So this is what I have to say nationally. This is what I have to say nationally. And before I go on, I wish to say that in the beginning, but I missed, to express my sympathies and solidarity with the People's Republic of China again. No matter what time I reach, I have to see what's happening in the world. And over 30% had already lost their lives in excessive flooding and rainfall. Yes, it's a huge country, 1 billion more, but any life lost from a sister country like the People's Republic of China and to extreme weather events is one too many. So I just wanted to give that message of solidarity. Also, I heard the Honorable Paris mention a World Bank report. I don't want to dispel, he may have read it, but it says about a number of people who reported in Dominica that were going hungry. A report is the final end of gathering information. So I may not want to contest the report, but I may want to contest how this information was gathered. I mean, this is my food, statistical analysis and those kind of things, and so on, mathematics. Yeah, numbers and science and so on. I mean, yes, what your end report is one thing, but how this information was gathered, what was the methodology, what is it, all of these things, because it's in Dominica, hungry, no food. Mr. Speaker, I have fig, breadfruit, plantain, share in. People take at my home. I mean, fig by my home staying and ripe and fall down. And that is with the whole village having free rein to all what I have. Free rein to what I have. My own supporters in the village tell me, Parliamentary, you must stop that. Parliamentary people finish with you because of the way I going on. But I just wanted to mention that. Okay? Mr. Speaker, in the Ministry of Agriculture, we are a family. The member from Cottage, the member from Pearbush, we have each other's back. And I've been hearing things, so I just wanted, because of what agriculture is doing, I think it warranted me just reiterating, even if the Honorable from Cottage has made a brilliant presentation on all of what it is. It's an agriculture budget, an agriculture and tourism budget, but it's an agriculture budget. And he mentioned, and I'll just briefly say, I will not dwell on them, to remind people the major investments that are going on in Mahaut. Over 13,000 plants, coconut jelly plants. As we know, this is one of the biggest things on the market. This is the easiest way you can make a money. Highest turnover, a low capital investment, high returns. A man come and say, "Yeah, coconut there." He pick your coconut, he goes, put a $3 markup very easy, and he can make a good living. I have a few of them from my constituency, making good living by just selling jelly nuts. So this investment, Mr. Speaker, will go a long way for the many people who depend on jelly nuts to sell. So that in itself will bear fruits. This was, again, cocoa. I too, Mr. Speaker, planted cocoa. Those of us in the communities have all grown to see the high demand for cocoa in Europe, which is now neighboring Martinique and Guadeloupe, in the US British Virgin Islands, the US Virgin Islands, the British Virgin Islands. As a matter of fact, local people in my community are making cocoa, and they don't even want local people to know that they have, just because they don't want it to sell it at the local price, they want to export it. So all those who can plant cocoa, I urge you now, if you have spare land, to plant cocoa. I know the Honorable Member for Granby have about 2 acres by now. The little spaces I have, already I can push a cocoa tree. Mr. Speaker, I put cocoa. So please do what you can, because it's a long-term crop that bear fruits, and the ministry has not let it get down in promoting the cocoa, and we have distributed over 17,000 plants to 85 farmers, Mr. Speaker. Again, citrus. Those of us who know very well the history of Dominica know of our dominance in citrus, a crop which is becoming high in demand regionally, and the Honorable Roy spoke to it, and Belize being the lead, but we having a very significant, a very advantage in terms of our agronomic practices and the conditions, and everybody else wants citrus. So we will be doing tremendous investments in citrus. The citrus certification plant, over $7 million. But of course, in addition to that, it was quite interesting, because the certification plant can handle 50,000 plants. But at the moment, even without the certification plant, we have about 50,000 plants getting ready, so that we can fill everywhere. And again, he have explained the criteria, and by the specific zones where it is more favorable, and they will concentrate on this. So I didn't want to leave that out. Mr. Speaker, and we have a targeted acreage. So it's not just giving everybody citrus plants. We want to make sure at least 1,000 plant acres are propagated. Again, we spoke of the agricultural tissue, tissue laboratory that we have, and all the staff is currently in place. And it's not only for the propagation of plants, but it serves as a seed bank, so that everybody and seeds that can be stored in terms of we have climatic events and so on, that we can easily have seeds to repropagate. And also that, I don't know, I can't remember if you mentioned, but that we are looking there to share these facilities with our sister OECS islands in the region so that we can pool our resources together, Mr. Speaker. Agriculture, again, I don't know how it keeps coming, but because there's a true friend, the People's Republic of China, in its 9th phase of the technical cooperation, we just signed in 1 Mile a few days ago, Mr. Speaker. But I just want to highlight for the very first time under this mission that we will now have an aquaculture expert for the very first time. And the mission will, and Dominica will now reposition itself to take advantage of the enormous abundance of fresh water that we have to invest in freshwater species. So yes, we are very quite confident that we can sustain ourselves with marine fish, but also for food security purposes, for climate change purposes, we need to have an alternative source, and also for the market. So yes, Honorable from Newton Roseau South may not like the taste of fresh fish, but the hotel may want it, and the neighboring country will want it. So we're not just investing only for food security, but also there is a demand for things like tilapia in the hotel sector, and also freshwater prawns, which is also in very high demand, that at the current moment that we cannot even meet the demand of the production locally. Because you would know that post-Hurricane Maria, the entire sector was destroyed. But thank God we now have about 10 farmers who have put in very high capital intensive, very high, their own capital into this area, and we want to support them. But we want to say we will really take off when the 9th phase will take effect, and we'll have, and they are not only going to give us technical support, Mr. Speaker, but also they're going to give us all the necessary equipment and the facility so that we can build model farms, so people can come and train, and we can produce all of the post-larvae and all of the other amenities and services that is required to have a fully functional sector. The abattoir, again, mentioned numerous times, its capacity of 1,000 birds per day, 50 pigs per day, and but of course, the ministry is not only building the physical assets, but in the measures that you heard Honorable Roy mention, that we are creating the conducive investment environment. And I don't want to call it really a subsidy, because sometimes, you know, the connotation associated with subsidy sometimes turns bad. But we are assisting, we are giving a helping hand, we are holding people's hand, and we are showing them that the level of confidence we have in their own investment. Because we stand to lose, because the assumption that people have when government gives is that it doesn't care, it's government money. If we are giving you 40%, if we are giving you 50%, that is money that can be used to do many other things. So we don't want to lose it. We want it to succeed. So we are not just dishing out a 50% for you because we don't care. We are 50% for you because we have very high confidence in your ability to succeed. And perhaps in the next budget cycle, we may come with another measure, or in the next 2 cycles, because you are so successful, we now ask you to give back the 50%. I don't know, it could be if you become so successful, which I think people have, because the numbers have been calculated. Honorable, we have spoken to the member from Cottage, of some scenarios of what you could do if you have 10,000 birds. How much you could make if you have 5,000 birds. So if today we give you a helping hand, Mr. Speaker, in the next 3 years, if you become a millionaire in broiler, of course, you know, it wouldn't be bad manners for you to give something back. So I'm just stating. Mr. Speaker, You heard that Honorable Roy mentioned about an insurance scheme, parametric insurance. And I too, thanks to my time in the public service and having trained with CRIF, I have a lot of knowledge about parametric insurance schemes and how they work. And Dominica has benefited tremendously from the excess rainfall package that we have with the CRIF and from the hurricanes and others. So I saw the suggested scheme for the agricultural sector as a similar thing. Because in every circumstance where we have had tremendous destruction to the agricultural sector, the state has always moved in to help. And I want to use help. I heard my colleague use the word compensation. But I don't really like the word compensation, because compensation is for people that pay insurance. I would rather say assist, because you didn't pay anything and we are assisting you. And so in this budget cycle, I see that we have put it in, and it is good. I mean, like everything else, sometimes it's a gamble, sometimes for the year you don't have anything. But what if? And the preparation and the key is what if, and that is what will make us resilient. And that is the resiliency we are talking about, Mr. Speaker. It's preparing yourself for the what if, so that you don't find yourself scratching your head or trying to go to others that already do not have to give you and trying to rebound your industry. And this time is agriculture. And perhaps in the next year we may ask to consider the fisheries sector, Mr. Speaker, because as we speak, the CRIF, there is already a parametric scheme set up that looks at the fisheries sector. And I'm happy to say, even as my tenure when I was chief, we have done all of the groundwork that would inform the CRIF of whether Dominica, is a country that could benefit and qualify. And also, we have done all of the groundwork, even in my time as chief in my former job, to have donor agencies being confident in information that we provide to them, agree to provide the financing to cover Dominica for fisheries parametric insurance, perhaps for 1 or 2 years. So I'm just saying this is a future thing for us to think of, because again, this will build resilience in our sector. And I say this because I have been a public servant that have administered millions of dollars to assist fishers, and sometimes back to back, Mr. Speaker. I'm not a very old man, but I've been doing a lot of things very early. In 2007, Mr. Speaker, Hurricane Dean devastated the fisheries sector on the East Coast. Government, this Labour Party government, went ahead and assisted every single fisher which was impacted, and not only that, at 100% of their loss. And you know what it was? A check at the Treasury. I did the assessment. I was spearheading everything. They got and the thing is with assessment value, especially in fisheries. If a man had an engine 5 years old, you can't go and get an engine 5 years old for him. So the replacement value that they all got was a new engine, a new boat. I can't go and get a used boat for the man somewhere. Somebody have to build a brand new boat. 100% value. And that was in 2007. Again, in 2008, back to back, Hurricane Irma completely devastated the fishing sector, on this time on the West Coast. I mean, we learned our mistake from Dean when we gave a lot of people cash, and some was not reinvested back in the sector. But again, we gave 100% assistance to the fishers. But this time we bought the assets. Brand new fiberglass boats and engine was given back to every single fisher who lost at a cost of almost $6 million. And I know, Mr. Speaker, the details, the accounts, because I had to report. The Prime Minister negotiated the money from somewhere, and I was the accounting officer. Then I was doing big things long time, You understand? Long time. I mean, really, why the man have to come and look for me? You understand? Because every cent, and I remember meticulously sitting with the accountants of that donor agency, and they say, yes, boy. First time they see that. Every single cent accounted for, and we assisted all of the beneficiaries, 100%, 5-point-something million dollars. Mr. Speaker. So I know, back to back, you're talking, and which government does that? I mean, in this world, you're not insured, and you're just getting everything you lost like that. And then we have had to make several interventions from time to time after that. When we had Tropical Storm Erica, it was a lower value of people who were affected. Some boats were flooded and sank. And from time to time we have done that. But these were the major ones. And then Maria again was.
We still building boat for Maria.
Yeah, Maria again was now on a whole different level. And I again was in a position to have been instrumental in administering all of the assistance that was given, tremendous assistance, immediately after a cash grant. And then we had a more structured program now. After everybody got the cash grant, 2 categories, money, dry check. Then we still proceed. I mean, you cannot forget these things, and these things don't get old, to repeat them. And that is why I will continue to repeat them. And maybe next year I'll still repeat it again, Mr. Speaker, because we ought not to forget. We ought not to forget. Our stakeholders who are out there ought not to forget what this government has done for them. Mr. Speaker, looking at my own portfolio within the ministry, fisheries or the blue economy, and I just want to put everything under the blue economy because fisheries is a part of the blue economy. In the budget this year, Mr. Speaker, we have allocated a sum of money to create what we call a blue economy unit. Because, Mr. Speaker, for a long time, I have been like a sole champion. And it's not good for a member of parliament or for a minister of government to be advising himself. And so we need to create a unit and to bring in the best talent. We tried last year, Mr. Speaker. I must say it's not a matter of lack of trying. And we advertised locally, and we could not get the caliber of persons that we wanted. This is how serious we want to create a blue economy unit, to lead the blue economy unit, and to come up with the things that we need to do and where we need to aspire past the traditional areas in where we consider blue economy, such as maritime and fishing and so on. So I'm putting out there, Mr. Speaker, post this budget, we will be putting out again a notice for vacancy. And we will put it regionally, and I don't know if yes is there, maybe we'll put it internationally, so that we can attract the best qualified. This is how serious we are. The best, so if any of the members of parliament know people on the outside in the diaspora who are qualified, it may not necessarily have to be qualified in natural resource management, but remember you are very good at projects and so on, and seeing how you can develop the blue economy sector in Dominica. Please let them know. Because we will put out a notice again. So we have catered for that in this budget. And as I said, it is a 3-year cycle. And you will notice if you look at the budget that the amount as it will increase in the second year and the third year as we keep building upon that unit to have to, and we find in the third year we'll be very confident that we have a unit that can look at projects, look at opportunities within the blue economy sphere to help propel this economy for the coming 10 years and next generation, Mr. Speaker. One of the interesting aspects I think a lot of people want me to speak about, and even my colleagues already telling me about the sperm whale. Mr. Speaker, in 2023, the Office of the Prime Minister, Mr. Roy, then was representing the Prime Minister, announced Dominica's intention to establish its first sperm whale reserve in the world, Mr. Speaker. And we have done for about 1 year all of the hard work. And you saw that we came to Parliament in June 2024, and we'd had the first reading of the bill to establish the first sperm whale reserve in the entire world. I just want to share with you recently my good friend, the Honorable Kozia member from the Salibia constituency, visited the king in Buckingham Palace. And the king, among so many people, that were there, bypass everybody, and he going to look for Honorable Cozier. Yes, sir. And the first thing he whispered in Honorable Cozier's ear, how is the sperm whale reserve going in Dominica? I mean, Honorable Cozier for the man going to tell him about the indigenous people or something, you know, how things. That is how the world is looking at us, Mr. Speaker. I mean, we may take it for granted, we may take it some little thing in the sea, and that is the next thing, you know, education, because the land space in America, Mr. Speaker, is 754 kilometers square. You know. In some literature, it has 753 and so on. But let's just say 754 kilometers square. The marine space, or entire exclusive economic zone, is more than 28,600 kilometers square. I mean, do that maths. Okay? Now, the sperm whale reserve that we are proposing, Mr. Speaker, and now let me say, the reason why we took the first seating, again, this is a government that listens to people, and before we went to Parliament, even if we had extensive consultation, we heard some further comments from members of the public and stakeholders that they want to have, there are some things they're not comfortable with. So we said, okay, we will take the first seating, and then we'll listen to what they have to say, and then we'll come back. But I'm happy to say, Mr. Speaker, that we have met with the people and their concerns. And already found that most of the concerns were things that were outside of the bill. It wasn't really in the bill. And when we explained to them, they said, oh, okay, we understand. But not that, Mr. Speaker. Consultation with these stakeholders have enabled us to enhance this sperm whale reserve bill. When you're thinking that people are going to fight you on things, people say no. The reserve was 923 kilometers square, Mr. Speaker. Based on consultation, we have now expanded the reserve to 1,231 kilometers square. Because the very same people that rely on that space, the space on the West Coast where the reserve is established, for their livelihood said, we do not only want livelihood, but we want an area of the reserve that is fully under conservation measures, that none of us can go and do any activities. So therefore, we want you to expand the reserve. And so we are proposing that the reserve will be expanded, and then most likely this amendment will come for the second, when we take the second and third reading, no later than I anticipate by September 30th, Mr. Speaker, because we have to get that done. The world is looking at us, the industry is looking at us, all of the major international players in tourism sectors and so on are looking at us and asking about that, because this is a major selling point for the Ministry of Tourism. And I heard the Honorable Roy, the member for Cottage, said in his gift that 30 to 50 cents of the tourism money comes to agriculture. But, Mr. Speaker, for us, we do not take, the blue economy. We give to the Ministry of Tourism. Because if you do a survey, as she said they was doing in the airport, you would find that a large number, more than 50% of the tourists, stay-over tourists who are coming to conduct blue economic activities. And not only they're coming to conduct blue economic activities, but these are your hedge fund managers, Mr. Speaker. These are your millionaires, a few billionaires, a few sheikhs. I don't want to even call other people's names. So these are the people that the marine space, the blue economic activities. But this is just one aspect. There are a lot of more we can do. We have not touched several things. We have not looked at the opportunities in deep sea mining. We have not even touched our offshore fisheries resources. But I have time in this administration, Mr. Speaker. Yes. And I plan to pace our development and strategy, not rush it into one fiscal year. And so we will take our time, we will plan things properly, and we will present it, and we will have sustained strategic growth over time. Mr. Speaker, investment as we speak now, we gave 108 engines to fishers, at a significant cost, because 108 engines at an average price of these days, $30,000, is no little feat. So we spend about $5.4 million in 1.9 million in just outboard engines. And Mr. Speaker, now we are in the phase of handing over boats. Now, out of 54 boats that beneficiaries were already approved for, we have already delivered 20, and the next 34 will be delivered soon, very early in this financial year, Mr. Speaker. But that being said, fisheries production in Dominica prior to Hurricane Maria was about 1,000 tons. Notwithstanding that we had lost about 30% of the fleet. Today, as we speak, fisheries production in 2024, and thanks to the hard-working fishers of Dominica, who take that risk every day. And I tell you all know about risk. I used to fish. I love to fish. I just don't have the time anymore. And I'm talking about offshore. If you have never experienced what it is to go out there, you would have no hesitation buying a pound of fish for $10, which is a usual comment I hear from my colleagues. But I would give them half a day outside there. And I bet when they pay a fisher $20 for the pound of fish, they will tell them, you know what, let me give you a tip. But I'm just saying that to say that this, at the end of 2024, fishery statistics were now well surpassed 1,000 tons, which is the primary figures, and we are now at about 1,200 tons yearly fisheries production. And these are the kind of figures that have given members of the House to have a competition. I remember Honorable Douglas and Honorable Blackmore competing who is the most productive. And again, they can do so because that is the detailed and measured statistics the ministry have when it comes to collecting fisheries. So we are one of the most reliable in the entire government system in terms of data and analysis and statistics. And again, this is a legacy that I left. So we have some good people there who are continuing that. But also, in addition to the boats, we have under the CIRC, which is an additional component we took from under the World Bank financing to put further investment into fisheries. And we decided that we had to address the landing site facilities, the services. And in doing so, we'll address, starting from the east, Saint-Sauveur, coming down to my area, Stowe, Soufrière, Scott's-Head, Newton, Foncolé, Mahaut, Bioche, Dubla. And I have spoken about this a number of times. All of these are investment costing between $3 to $4 million, Mr. Speaker, and they are various types of interventions. Some are landings, some are slipways, some are facility enhancement in terms of the building administration, locker room buildings, some are amenities. And so all of these are strategic investment based on the need of the specific areas and that we are investing in. And yes, we have had some delays in terms of implementation, and I do not want any fisher to give any of my colleagues any pressure. I take it, Mr. Speaker. I'm the minister responsible. Honorable Pemberton, tell them, check D4, tell them, check me. Our ministry is responsible. There have been delays. I don't pass my blame to anybody. Yes, I don't pass my blame to anybody. So there have been delays, but I have been reassured that in starting September, all of the designs, because the contracts in which how they were assigned is what we call design and build, and to save time, because the project is coming to an end in December, so it had to be designed and built. So I am assured that the designs are complete in August, and then the contracts will be signed for works to start immediately, Mr. Speaker. I have spoke to fisheries production. However, we have really common stream, and Honorable Laville from the Mahaut constituency mentioned about the ongoing, because Mahaut is one that was in advance. So this is why he spoke about they completing and just doing many remedial works. Mr. Speaker, I spoke to aquaculture. I mentioned it, but I want to say a little more because it's a sector that has a lot of potential, and the demand is high, and of course the returns are very high once it is successful. So this is why we have been trying on our own, but this is why, again, I want to say thanks to the Chinese mission for finally taking on aquaculture, where we will receive all of the technical support, of the material support, so that we can hold the hands of the existing farmers that we have and bring them to a high level of productivity and profitability. Because I do not just worry about productivity. If something is not profitable, and if something is not profitable, people will not be attracted to it. So I just want to boost our production, but I want people to make money and people to sustain their family and to be able to buy pickup trucks and so on, all of the money that they are generating from their farm. So profitability is a key component, Mr. Speaker. Mr. Speaker, the Roseau Fisheries Complex fish marketing component, a key area for the development of fisheries. And I believe last year or two, we gave the management authority to Dexia, which we thought was the most fitting government agency and entity to manage such a facility, since the ministry itself and its system and accounting was not really designed to handle commerce. And then I'm happy to say that since Dexia have been putting things in place, have been signing contracts with fishers, and have been they themselves exploring different market forms. And the honourable member from Granby shared with me packages of fillet fish that is already now dolphin fish that is available at the facility. And also, but the core of this facility is not only marketing, but to service the fishers with ice, storage. So it also has a social function, okay? And most of that service, I want to let people know, is heavily subsidized so that we can make fishing and fish preservation very affordable to the fishers. Because there are two main components that a fisher goes out with, and that makes almost whole of its operational cost, which is fuel and ice. And the reason for ice is because we have trained our fishers so well that fish preservation and quality assurance has become a major part of how they do their business. And I mean, Scott Z, Honorable Pemberton is a great example of that. We have many fishers in Scott Z. And these days, Mr. Speaker, if a fisherman do not have access to ice, he will not go to sea. So ice, as trivial as you may see ice as something simple, why do you put so much emphasis on ice? Is because ice is critical to the whole fishing operation. And that is why we want to give a commitment to the fishers in Dominica. We have heard your cries. We have 3 major facilities, Marigot, Roseau, Portsmouth, that is owned by the state. And also we have facilities in Dublin, owned by the Dublin Fisheries Group, but which the state provides support to because of the nature of the service it provides. And we want to tell them something. We hear your cries, and the machine in Portsmouth is down. It is no longer efficient. And the one in Marigot, and we hear your cry. My PS is there. I want to say, PS, in front of the country, let us take hold of this matter. Let us deal with this problem. Let us install the new machine that is sitting down in Portsmouth. Mr. Speaker, Mr. PS, I say in there on national radio, on national TV maybe, let us issue a contract to the gentleman that is responsible so that the people of the fishers of Portsmouth, because we have a new machine, we have done a lot of the spending, but the last piece for us to install it, I don't know, we're in a jam somewhere. So I want us to solve that. The ministry will solve that so we can increase the ice production capacity in Portsmouth, coming out from a 1-ton machine to a 2-ton machine, which is a 100% increase in capacity. Mr. Speaker, the blue economy, there are other sectors that infringe on the blue economy. Anything you have that involves the sea, I can take credit for it, Mr. Speaker. So, Honorable Charles mentioned about the facility in Champagne. I will take credit for it too, because it is built solely there, not because people like to watch the trees on the hill. It's because they want to go and bathe in Champagne because of the bubbles, because of the sea and the beach. So I will take credit for it. Mr. Speaker, I will take credit for the development and of the timely construction of the jetty in Anzimi. I have been a personal advocate, Mr. Speaker, for the jetty for a very, very long time. Deep advocate. So I take it very personal and very emotional too when I hear now of we're ready to construct the jetty in Anzimi, And I know for a fact that components of that jetty is being fabricated off-site so that they can carry on-site. And the jetty has many uses. It's not only going to serve the fishing sector, but it's going to serve the commerce sector of agriculture, a lot of transportation, movement of cargo to nearby Lake Saint Mary Gallatin, and also for the tourism sector. So this jetty, if you can see the number of sectors and areas, all of us taking credit for it, Mr. Speaker. This is all our jetty. You understand? This is all our jetty we will share with the honorable member from the Cottage constituency. Mr. Speaker, I don't want to speak to it about it isolately, but in my delivery before, in talking about the hurricanes and the cost and so on, sort of I've hinted to it over the effect of climate change on the entire sector that I serve, and expecting more frequent and stronger hurricanes. God bless. We have not ever seen. I haven't seen anything yet. We can keep our fingers crossed that we don't get it. But on the international arena, Mr. Speaker, you know, the notion of climate justice is taking shape, and also the establishment of the loss and damage fund. But as you can see, while this gesture is very noble, Mr. Speaker, the individual nation, the nationalistic view many countries are taking now, perhaps may hinder this fund. So I just want to make an appeal again in Parliament to whichever of the developed countries who are listening to us, that please note that we are net exporters of carbon, net generators of carbon, and that they honor their commitment or the pledge that they have made to put in a special fund to cater for those of us who have not created the problem but are bearing brunt of the problem. So I just needed to say something small on that. I wanted to go more and more, but I suspect I will go out of time. So I will just stick as that. But I wanted the record to show that we...
Honorable Member, as you mentioned time, you have just about 10 minutes left.
Don't worry, I'll get time. Yeah, I'll get time. That alone, even one thing I'm not afraid for is getting time. I'll get time, Mr. Speaker. And so, yes, I needed the record to show that because it impacts not just the marine environment, but Honorable Roye, the member for Cottage, clearly explained to you and that our development in agriculture can no longer rely on open field agriculture, Mr. Speaker. We can no longer rely. We have to go in enclosed, semi-enclosed systems and hydroponics for us to be able to sustain our own food security, much less to talk about other people's food security, which is export. Because, Mr. Speaker, you can have all the money you have in the world, and when push comes to shove and hard times come, you cannot eat it, which was what the COVID-19 pandemic had demonstrated to us, Mr. Speaker. No matter how much money you have, and you didn't have the vaccine, what are you going to do? And you didn't have food to eat, what are you going to do? You cannot eat money. So we have to invest in these technologies to protect ourselves and to protect the people in the key area, like where Dr. Elvin McIntyre represents in Mount Prosper, and all of the prime area, even in Grand Bay and everywhere, in Salisbury, where Honorable Jester Paul represents. These are the traditional production areas. And if we do not invest now in this sector, then climate change will prevent us from achieving our own food security. And some time ago, I think it was last year, I indicated there is a report that we did looking at the impact of climate change on the marine environment. If by the year 2015 is not far, 25 years' time, I will still be alive, or perhaps still be in Parliament, I don't know. But Mr. Speaker, that is not far. And it shows an increase in 2 degrees will cause a level of warming of the ocean that will make many of our traditional species move away because the water will become too hot. All right? So species that live in the tropical region will move to subtropical region and will move to temperate region as the sea temperature adjusts. So these are things not to scare us, but to bear in mind and to make the people who are responsible for these emissions know that they have a responsibility to the loss of damage fund, and they put something in it so that it can help us to use for the adaptation and mitigation. Mr. Speaker, let me take some time to speak to the beautiful constituency of Petit Savan. I inherited a constituency that is highly supportive of the ruling government, Madam Speaker, and people who have done so for as long as I can remember, since 1990. The Petit Savan constituency has supported the party which is currently in power. And I want to say that to them that, as I've mentioned earlier, let your heart not be troubled. There are things that we speak about, there are things that we have done, and there are things that will come. And it's all a matter of time. But first, I want to speak to the people of Petit Savan who were resettled into the Belleville-Chopin area. And as we know, there has been a lot of public debate, and rightfully so, and concerns from the people regarding the certificate of titles. The honorable member from Roseau has indicated that there is a move, a heightened move, to ensure that certificate of titles in the quickest possible times are issued. And we will begin with the Petit Savan constituency. And I know some information, but lack of caution, I will not say as yet, that the number of titles that have already been processed and the first set of people who will be issued their title in the coming months, Mr. Speaker. So it will start, it will be done, and it will be fulfilled, and each and every occupant, the 300 plus that own a unit in the Petit Savan, a new resettlement area, will receive their title. Let not your heart be troubled. Okay, you will receive your title. And furthermore, Mr. Speaker, in recent times, the Ministry of Housing have had consultations with the people there. And they have already established what you call a special committee, not only to look at titles, but we don't run from things. And we do not pretend that there are not issues within the housing areas. We have never run away from that. And the special committee has been set up to look at the issues every occupant has. I'm not going to tell you we're just going to come like in a brigade and fix everybody's issues. But this will let us know exactly what issues people are facing or not, and that so that the ministry can address it in a strategic way. Because without information, it cannot budget. We do not know how much it will cost. 10 million, 20 million, how much it will cost. So this information will enable us to know how the Ministry of Housing will strategically move to assist these individuals. And this is a promise, because we are responsible. We give these individual homes, and to the extent possible, we give our commitment to assist them, Mr. Speaker. Mr. Speaker, again, sticking to the area of Petit Savan, again, not shying away from cries of the public, we established the connection that was lost since Hurricane Maria, and we call it the Petit Savan connection. And this is a connection which I share with my sister colleague from the Plaine constituency. And I could clearly say, yes, Honorable Williams, I do my part already, you know, I put the connection, the rest is yours to go to the list. But I have a profound interest, not only in the Petit Savan constituency, but in the well-being of my colleague. That is the kind of people we are on this side of the House, Mr. Speaker. It's not only ourselves and our constituency, but my colleague. And I just want to say to the people, we have discussed it, we have a plan, and we will speak the truth to you. It's not like today we're going to come and rip out the whole road and redo it, but we're going in a major way to improve all of the key areas that the residents from Daly and even Petit Savan have indicated to us, that Parrep, if we just do this, Parrep, if we just do that, we understand how things are. We can work with that. And I'm telling you today, in collaboration with the member from the Plaine constituency, we're going to move earnestly post this budget, whenever it ends on Thursday or Friday. Immediately, we're going to make all efforts to address these areas. And we have gotten commitments from many people of the community that they will give us their support. You know, people speak from the outside, you know, but the real people that matters, the real people that pass on the road, the real people we're interacting with, saying something different to us, saying, don't worry, them people are talking. We're not passing on it. If you help us, if you give us tariff, if you give us cement, we will help you. We will do what we have to take because we know how things are. And we are going to move to do just that immediately after the passing of this parliament.
Honorable member, you have 2 more minutes.
10.
Mr. Speaker, I move that the Honorable be given additional 10 minutes to complete his presentation, please.
Mr. Speaker.
Mr. Speaker.
Hold. It has been moved and seconded. Yeah, honorable member, you may take your seat briefly. You can take your seat briefly. Yes. It has been moved and seconded that the honorable member be given an additional 10 minutes to complete his presentation. Those in favor? Those against? The ayes have it. Honorable member, you may proceed.
Thank you, Mr. Speaker. Mr. Speaker, again, on the community of Petit Savan, the original community, this government, even before my time, had always stated that even if the people were moved, that it would upkeep and maintain the community so that people can return to for leisure, for pleasure, and for economic activity, or even for spiritual reasons, Mr. Speaker. And I say for spiritual reasons from time to time, we do have burials in Petit Savan very frequently. We do use the Catholic Church, even if, you know, it had the impacts of the hurricane. And there are many people still residing there for economic opportunity, doing farming, Mr. Speaker. And so if you notice, the place is well kept, the roads, and the people are very appreciative. And not only that, we do have a set team of people employed in national and programs that keeps the place clean and beautified. So this is a commitment government gave. But I just want to add to that, in recent time, we may have heard the Prime Minister at one of the press conferences indicate that we will go further, Mr. Speaker, to encourage more economic activities. Now that Domleg has run the electricity bus through, of course, albeit that, you know, opportunistically, because they will head into Delis and Plaine and so on. But the grid is now energized. And the next move would be to give Domleg the authority to reconnect individuals. And this is a commitment the Prime Minister have made, and he stated in a recent press conference. And the reason being so, because we have seen, other than agriculture, major development in terms of poultry. Mr. Moise in Petit Savan, one of the dominant poultry persons coming up in eggs now, has made significant investment in poultry. And if he has power, then he will make additional investment. And there are other people who will make an additional investment. And not only that, Mr. Speaker, I want to say something about bailiff. Bailiff is a cash crop that has sustained many of us from this part of the island, from Petit Savan, Fontation, Bagatelle, Delisy. In Petit Savan has one distillery. And bailiff is something that when you're broke, you're going to make a piece of bailiff, Mr. Speaker. You want to buy a TV, you're going to make a piece of bailiff. You want to buy a city by courts, you're going to make a piece of bailiff. So in this part of the place, it's not a place where people rely on government. Why? Because you have bailiff. Bailiff solves all problems. You need a money to go overseas, you're going to make a piece of bailiff. That is how we knew it. School going to open, your mother make a piece of bailiff. That is how it was. So I want to give the credence that crop has. I think we have, even within our own ministry, paid too much not attention to it as a crop and as a productive sector. A productive sector that caters to the people, the most vulnerable people on the lower end. All right? So I felt it needed that kind of attention in Parliament, Mr. Speaker, so that all of us who have something within our budget that we can lend to that sector, do it. Honorable Pinard is small business, because, you know, Abeol Distillery is a small business. And as we speak, I know my friend is there, Mr. Starrett, trying to revive his distillery at a tremendous cost. and the system itself is not designed to give him that support. So I'm just calling on all of us, because he's turning into a wood system, into a boiler system. This is high-tech work. I mean, you may pass there, you may see galvanized, look, but the science and the technology beyond oil distillation is remarkable. These are people that have to know what they're doing. So I just wanted to point that out, Mr. Speaker, and that we can perhaps give in the support that is required, because when somebody has a distillery, people from all over, all the way from Capuchin, come to Petit Savan to Bailey. Mr. Speaker, I'll go quickly. We must touch on housing, Mr. Speaker. In Center, where I share with the honorable member from Grand Bay, we have 47 residents from Dubic who will be getting brand new resilient homes. And if I don't have any Christmas, if my wife don't give me Christmas, my child, nobody will give me a Christmas. Honorable member of Roseau, please give me the Christmas of the people from Dubic being able to go into their homes by December. And that is it. And that Christmas, because I feel for these people, and that is the problem with my representation. I just represent too much. And when I represent, I take it very deep. These people are family to me, friends to me. I know where they are, even if the state is paying their rent, but pay the rent. No, it is a commitment that we gave since we broke down the petrol costs that we have and so on. But paying somebody's rent is not all. Home is a different feeling, and some of the areas they are may not be too conducive. So they have been very patient. They are strong supporters of this government. The record shows that, and we have had several deadline shifts. Through no fault of ours, Mr. Speaker, there are inherent reasons why these things have happened. But we are hoping that by this Christmas, they can be given their keys and they can move in. So this is what I want to say on that, Mr. Speaker. In terms of housing, again, Mr. Speaker, we have done, there are many things, constituency-wise that we do. But the nature of our work, more than 50% you cannot say. These are one-on-one interactions. These are social interactions. These are personal touches, and then you're not going to come on Parliament and say this thing. So when you see you here talk about the constituency, mostly people talk about concrete and those kind of things and so on, because these are things you can point out too. But the real touch of a parliamentarian, usually, I say 50%, but maybe 75%, really you cannot say, because I believe these things are sacred, and you to keep the humility of people, and they will speak for themselves. And the reason why we are here 25 years later, and the reason why there's 19-2 is because these people have been speaking for themselves, Mr. Speaker, at the end when every election is called. So it's not all of the bands, it's not all of the show, it's not all of the flair. It is people's inner conscience dictates what they do when they go to that booth. People's inner conscience. So, Mr. Speaker, sports. I know somebody mentioned, Honorable Oscar George, mentioned about sports. We have tried to really ramp up sports, and we have had the lighting of the playing field in Bishop, and every single day this playing field is occupied with young people. It brings me joy. I really don't care about the light bill. I tell them if you have to take a load to pay the light bill. The fact that they are on the field every single day, they are now in first division. I don't believe they have lost a single game. And they are just active and making use of this playing field, Mr. Speaker, gives me great joy. And again, we would have heard about the T20, the famous T20 cricket league in Bagatelle, which we call the Baffin Point League, because Bagatelle, Point Carrick, Fonseca, Fab, and all of the hamlets. But it's not only that. While it is focused in this area, it comprises of players throughout the entire constituency. Although this season, Honorable Roll has sort of forsake us, because he loving that league so much and the entertainment that goes on there. Last week we had 5,000 people, Mr. Speaker. He missed that. He missed that watching one match. But the second semi-finals is this year. So, Honorable Roll, we're expecting to see you. I cannot leave, Mr. Speaker, Bellevue Chopin, brand new school, Honorable Octavia Alfred, the member of constituency, 2.8 million in value, 8 classrooms, sick day, auditorium, catering for the, I don't want to use the right word, handicap, but I can't get it proper. especially challenged, Mr. Speaker, state-of-the-art school that is expected to take in students from Belleville, Chopin, and the Petite Savant School. And I even believe perhaps, perhaps the old South, but then we have Granby to Granby is large, so, and Tetmon have its own school. But the Belleville Chopin School, Mr. Speaker, coming on great. I look at it every day. I stop there, I go there. And I'm very proud of the work that is being done, high quality. And I want to thank the ministry and thank the government and thank the People's Republic of China for making the investment and we being a beneficiary of this school, Mr. Speaker. And as we speak, this school, is never keep turning out benefits. We are about to have a whole rotation of 8 young individuals doing the security at this school starting August 1st, Honorable Alfred, and thanks to your ministry. And these are 8 new jobs, brand new jobs, just being created as we speak. And people talk about young people and being on the job everywhere. Let me tell you something. This is one of the hardest jobs I had to get these 8 people. And I said to myself, but what is people talking about young people who have jobs? Because we could not find, Mr. Speaker, all man in their vibes, no matter what kind of vibes, but all man in their vibes, and all man making money. So therefore, it was a real struggle to get 8 young people. And when you talk about unemployment, what are you talking about? Because the person not by cost, the person not in a bank, you consider them to be unemployed. That is your only notion of employment. My brother, man have right, man have house, man have all kind of things, and how is that they're not employed? You understand? So I struggled. Even up until today, I think I maybe get the last 8 names because everybody occupied, Mr. Speaker. And we don't even have an airport building. Yes. But I want to say the last for last. The Loubier to Granby Road, but I will say the Loubier to Bagatelle Road, Mr. Speaker. But first phase, Loubier to Granby, 116 million, 117 million, thanks to the UK government. Thank God, before they cut their aid budget by 40%, what we were able to secure. And we know of the work that the Honourable Member from Granby and the Honourable Prime Minister Member for Vickers had to do to save that fund. So it didn't just come easy. They had to rescue it, and today we are benefiting from it. 10.4 kilometers of road, 10.5 kilometers of road, significantly enhanced. And not only that, the community of Pishley has sort of benefited because we had to, in addition to building the Shotwell Road for over $6 million, which is an agricultural road, but now serving as a back road since they are working on the road. But inside the secondary road in the community of Pishley have now been significantly enhanced to facilitate the flow of traffic. So these are additional bonuses that we have had from this road project. Again, not to say numerous young persons are employed, and as the project is in its early days, even as in its early days, significant work has been done. And as the work continue into drainage and so on, there will be demand for much more people on this project, Mr. Speaker. And this road, we have 2 companies, Sotradom, regional contractors focusing on the bridge, and as we speak, the first bridge is being constructed in Pishley, and soon Sotradom will start the major bridge in Mitcham. I assume as soon as they are finished by Honourable Frederick, the member for constituency. In the Pegua, the entire construction team will move to this road, Mr. Speaker. So lots of benefits, but I just want to tell our people, please, I hear their cries sometimes, but with development comes sacrifice, and we have to, be able to work with the contractors, the bus drivers, the pedestrians, and bear a little inconvenience for the greater good, Mr. Speaker. I could go much more, but I will not ask for more time, Mr. Speaker. I think I have said a lot. I just give me 1 minute to just close and say I'm going to thank the people of the Petite Savant constituency. In all its parts, it's a large constituency, geographically, and for your support, for your hospitality, Mr. Constituency. When I go out, I don't have to carry any food. I can eat everywhere, any home. I can come back. That's why, my belly was a little big because, I have to eat everybody's food, and I cannot say no, Mr. Speaker, and especially in Pishley, a lot of Manikou, always tuned in by Mrs. James.
1 minute.
And, you know, I love the job. I love the job. I love the people. I thank my family for the sacrifice they bear from me, because as you say, when I leave in the morning, I don't come back home very early, Mr. Speaker. And what else can I say? It is the best job ever, and I will do it until I lose the passion, which is no time soon. I have not been able to address everything asked of me, but I try to do one at a time, and I will eventually try and get everybody. And I tell people the truth, and people say that, people talk about that. Sometimes, you know, you don't like the truth, but I rather tell you the truth, Mr. Speaker, so that you don't have no heavy stone carrying on your head. We will get to everybody, and we will do what we have to do, and in times everything will be good. Thank you, Mr. Speaker.
My eyes fell on Honorable Williams first. However, you guys can decide. If you want to go, I'll allow you to go first. Because my eyes fell on you first.
I will go first.
You want to proceed?
Yes, I'll go.
Okay. So I recognize you. Honorable Williams, you may proceed.
Mr. Speaker, I'd like to move to the seat of Honorable Lloyd for more visibility, please.
Yes, permission granted.
Thank you. Mr. Speaker, I rise with a deep sense of pride to make my contribution to the 2025-2026 national budget debate, to speak on a budget which I believe is another reflection of this government's commitment to social justice, equity, and national progress. This is a people's budget, Mr. Speaker. I'm sure we all agree. And as with every policy of this government, this budget is focused on ensuring the well-being of Dominicans from every facet of our society, from every walk of life. And so, yes, I am quite proud to be part of a government that has once again formulated a package of social and economic policies which directly addresses the needs of our people. Mr. Speaker, allow me to extend thanks to the Honorable Minister of Finance for his competent and comprehensive presentation of the 2025-2026 national budget. His clarity, vision, and command of the national development agenda were evident throughout. I also wish to express deep gratitude to the Honorable Prime Minister for his steadfast leadership, his guidance, and his deep commitment to the people-centered approach to governance that this budget represents. Under his stewardship, we continue to chart a path of progress, resilience, and equity for all Dominicans. Mr. Speaker, I didn't ask for permission, but I would like to refer to my notes, please, as is the proper thing to do.
Permission granted.
Mr. Speaker, at this time, I wish to extend greetings to the wonderful and supportive people of the Plaine constituency, who I continue to represent with great humility and gratitude. I remain grateful for the confidence they have placed in me, and I am striving every day, God knows, Mr. Speaker, to be worthy of their trust. I also want, Mr. Speaker, to extend heartiest commendations to the organizers of the Plaine Vacation 2025, which got underway last weekend. Many of you would have seen the videos of what's going on in Plaine. I got I got many comments about the jubilation at the ecumenical service at the Jones Beaupere Primary School. Over 600 sons and daughters of our soil returned home, some after decades abroad, to reconnect with their roots, to rekindle friendships, and to reignite their love for the place we all proudly call home. Honorable Minister of Tourism, the direct flights to Dominica were indeed a blessing for them. They took advantage of it. La Plaine, as we all know, is a nook of resilience, of rich culture, and of boundless potential. And that was on full display last weekend. Mr. Speaker, there was a carpenter that I met on Saturday, and he was not shy to say, "Doc, I made a lot of money this morning." Saturday was market day, and he also volunteered the information that his brother made a lot of money. I met someone else who told me there was such a great demand for castor oil, so it seems money is flowing in La Plaine. I want to assure the organizers of the La Plaine vacation of my support and willingness to work with them to push similar community initiatives. I believe working together, there is so much we can do to continue to uplift La Plaine, and I want my constituents to know that I am all in. Mr. Speaker, the 2025-2026 budget comes at such a critical time in our national development. Like many other countries, we are feeling the effects of shifting global trade policies and international economic developments. The world we live in is a fragile place, and in response, our government must develop and implement policies that provide our people with hope and with opportunity. This budget is a forward-looking plan. It is a budget crafted with the understanding that growth must be inclusive and that every Dominican, regardless of where they live or what they do, must have a fair shot at success. Mr. Speaker, I'm gratified that the budget offers targeted support for vulnerable, creates new opportunities for youth, strengthens our infrastructure, and invests in key economic drivers like agriculture and tourism. Let us look, Mr. Speaker, at the transformative projects currently on the way across our country. The construction of the international airport is 40% complete and progressing on schedule. You know, just 2 weeks ago, my little nephew reminded me, I don't know what stirred his memory, but he said, "Auntie, you told me we'd have an international airport when I turned 10 years old." And confidently, I could have responded to him, it is going to happen. By the time you're 10, Dominica will have its international airport. This represents long-term economic growth. It will generate sustained employment in tourism, transport, agriculture, and services for decades to come. That's jobs in hospitality, logistics, and the service sectors once the airport becomes operational. With long-haul flights from key markets, it will make our island more accessible for business, trade, and investment. For farmers and agro-processors, it means easier access to export markets and greater economic returns. For young professionals, it means increased opportunities to work and thrive right here at home. The airport is a platform for national transformation. Likewise, the geothermal energy project is another massive project that will transform how we do business here. It means cleaner, cheaper, and more reliable energy for our homes, schools, hospitals, and businesses. Mr. Speaker, we expect that this will lower electricity costs over time, something that the people of La Plaine and rural Dominica can all be hopeful about. The Cabritz Marina the world-class hotels nearing completion, the rehabilitation of the East Coast Road, the Loubier to Grand Bay Road, the upcoming Roseau Enhancement Project, and the expansive list of national projects already started or about to get underway, these are all creating jobs, improving access, and making Dominica more resilient, more progressive. Mr. Speaker, in housing, in agriculture, in education and infrastructure, this government is investing heavily in people. These projects are not taking place in isolation. They are carefully integrated to lift our communities. And as a parliamentary representative for the Plaine constituency, I will work tirelessly to ensure that my constituents are equipped and empowered to take full advantage of the opportunities that lie ahead. Take, for example, Mr. Speaker, the $2 million allocated to the Aid Bank for educational loans at an interest rate of just 2%. The young people of Plaine, Boetica, Dalis, and the entire Southeast are ambitious, intelligent, and full of potential. But potential must be nurtured. And that is why I am so enthusiastic about this facility. 2% is a giveaway. I want to encourage our young people to take full advantage of this program, whether for studies in engineering, hospitality, digital technology, or construction. These are skills that Dominica needs and will need very soon with all these major projects on the way, and we stand ready to support them. Similarly, Mr. Speaker, the $10 million facility at the Government Housing Loans Board, what a fantastic opportunity for public officers. Again, I want to encourage the public and police officers from the Plaine constituency to jump right in. Jump on this. Don't let this absolute steal of a deal pass you by. This policy is a true safety net for you and your families, and your government is demonstrating its willingness to meet you halfway, to work with you. So take advantage. Housing. Mr. Speaker, I want to thank this government for its transformative housing interventions across Dominica, including in the Plaine constituency. We are seeing new homes, climate-resilient homes, being delivered to deserving families, and I give you my word that those who have been promised homes in my constituency will receive them. Right, Minister for Housing? Some homes will be delivered by the end of 2026, Mr. Speaker, and I am pleased to note that we now have a dedicated attorney working on the ownership titles for recipients of government homes. This is something that my constituents can look forward to, knowing that this government always delivers on its commitments. VAT and import duty removal. Mr. Speaker, one of the most commendable and compassionate measures in this year's budget is the removal of VAT and import duties on a range of essential food items. For many vulnerable families across Dominica, particularly in rural communities like those in the Plaine constituency, the rising cost of living poses a daily struggle. Therefore, Mr. Speaker, by reducing the cost of staples such as rice, milk, and flour, and sugar, this government is ensuring that every household, regardless of income, can put food on the table. It is a direct, meaningful intervention that will ease pressure on low-income earners and support the dignity and well-being of our people. Mr. Speaker, this is how policy meets people, by placing their basic needs at the center of decision-making. Mr. Speaker, as a medical doctor, I am acutely aware of the long-term health implications associated with the frequent consumption of processed and nutrient deficient foods. I fully acknowledge that some of the items benefiting from VAT and import duty waivers may not align perfectly with the principles of healthy eating. Let me confess, Mr. Speaker, that during Hurricane Maria, while I was at the hospital, I had to eat a piece of salami. I won't habitually eat that, but it came in handy. I was hungry. Did I have to stay hungry? There was no vegetable, there was no fish, so I had to eat a piece of salami. However, we must be realistic, and that's the point I'm trying to make. We must be realistic and compassionate. In this economic climate where many families are facing financial hardship, these measures provide essential relief and ensure that no one goes to bed hungry. Access to food, any food, is a basic right, and this intervention helps meet that need. At the same time, Mr. Speaker, I take this opportunity to encourage all Dominicans to make healthier choices wherever possible. Let us recommit to eating what we grow, fresh fruits, vegetables, ground provisions, and herbs that are abundant across our fertile land. Investing in our health starts with what we put on our plates, and this government will continue to support both affordability and accessibility as we strengthen food security and promote healthier lifestyles across the nation. My constituency is no stranger to growing what we eat and eating what we grow, and I will continue to work alongside these people to make healthy choices. But let me be clear, Mr. Speaker, this measure will bring relief to my people, and I welcome it. Support for the vulnerable and social protection. Mr. Speaker, I am deeply grateful that this budget continues to prioritize the vulnerable among us. Through its commitment to the Public Assistance Program, the Roosevelt-Skerrit administration is ensuring that no family is left behind. We have not only sustained, but strengthened our social safety net with continued assessments to reach those most in need. I want to point out, Mr. Speaker, that our policy is never about handouts. It is about justice, dignity, and giving every Dominican, especially our elderly and differently abled, a fair chance at a decent life. In this context, I must also thank the many public officers and community workers who support this mission, our NEP workers, our teachers, nurses, doctors, and village councils. Their service ensures that government policy is not just words on paper, but action in communities. Feeder roads and infrastructure. I must also thank the government for its continued investments in rural infrastructure. The improvement of feeder roads is essential to our agricultural output and access to markets, and undeniably so. I welcome the assessment underway for work to begin on the Station Road in Plaine, Honorable Minister of Agriculture. I am eager for us to identify a contractor by mid-August to get this project going without delay, Mr. Speaker. I know just how important the rehabilitation of that road is for our farmers. It will ease the daily challenges they face in transporting their produce and accessing their lands. The ongoing rehabilitation of the Pettit-Savan Road, and you heard it mentioned by Honorable Defoe, it's another milestone which will significantly enhance connectivity and access for residents and businesses in the Southeast. Mr. Speaker, it has taken some time. It has taken some time. But last financial year, we saw real progress on the link road, and it is now passable to vehicular traffic. I don't have to say too much on the benefits of this road. I think we're all quite aware. These are obvious. reduced travel time, improved road safety, and new opportunities for trade. So I look forward to strengthening that link in the weeks and months ahead with my companion and colleague, Honorable Defoe. In agriculture, Mr. Speaker, agriculture remains the lifeblood of many families in my constituency. As we work to improve feeder roads and expand extension services, I am focused on fully integrating the Plaine area into national value chains, from production to packaging to export. Our people have the land, the skill, and the passion. What they need and what we are providing under this budget is support. So I look forward to collaborating directly with Honorable Roy and his staff, first on accessing these agricultural lands for the young people in my constituency, and secondly, on accessing the inputs that are available to grow their holdings and increase production. I am keen to take advantage of the work Dexia is doing to source markets in the US and UK, as well as BVI and the USVI. This means more opportunities for farmers to sell their crops at better prices and more income for their families. If we can grow more, ship more, and do so on time, we can continue to strengthen agriculture as serious business. And it will support jobs, it will feed our families, and drive economic activity in our communities. This is why, Mr. Speaker, I have my eyes on that $1 per acre per year land being made available at Newfoundland. Youth involvement in agriculture is key to the sector's sustainability and our efforts to build food security. And I will be engaging very soon with the young people of my area to pursue this godsend opportunity. Mr. Speaker, with policies like these, can we have any doubt about this government's commitment to the agriculture sector and to food security? The answer is no. Community tourism. Mr. Speaker, another exciting opportunity highlighted in this year's budget is the Community Tourism Accelerator Program. It will provide training, microgrant, and access to small business funding, as well as assistance with branding and storytelling for community tourism accommodations. I believe this initiative is a game changer for rural development. From Plaine to Boetica to Dalis, we are brimming with talent, cultural capital, and small business potential. Mr. Speaker, I want to strongly encourage the communities in the Plaine constituency to grab hold of this opportunity with both hands. Let us organize ourselves, build our proposals, and place ourselves firmly in the running to become a model community for the Village Stays program. Our communities are rich with heritage, history, cuisine, and natural beauty. Think of it, Mr. Speaker, the White River, Victoria Falls, Glacis. You know, just about 2 weeks ago, a technical team from the Ministry of Tourism was visiting, and they were so impressed with Glacis and thought it a low-hanging fruit. And so we're going to look forward to its development. We have what it takes to welcome the world into our homes and showcase the very best of Dominica, authentic community-based tourism at its finest. With the right support and initiative, the Plaine constituency can become a national model for grassroots-driven tourism development. I would like to suggest, Mr. Speaker, that the Plainians who are in Dominica now should consider this as an investment opportunity. How can members of our Plaine diaspora play a part in the development of small community-based tourism accommodations to take advantage of the influx of visitors that will come with our international airport and other major national projects underway. We can talk about it. Now to report a bit on social services. In every corner of our beautiful island, this government continues to plant the seeds of resilience, equity, and compassion. And nowhere is this more evident than in the work of the Ministry of Health, Wellness, and Social Services. And as a minister responsible for social services, I have the honor of bearing witness to the impact of our policies and programs on the lives of our nation's most vulnerable. Children needing protection, single mothers battling hardship, the elderly facing isolation, and families stretched to their limits. And so today, Mr. Speaker, I affirm without hesitation that social protection is not an afterthought in development. It is the foundation of a fair and sustainable society. A new era for social protection. Mr. Speaker, in pursuit of our national commitment to equitable and inclusive development, the Department of Social Services continues to be a cornerstone of support for the most vulnerable. With just 5 years remaining to achieve the 2030 Sustainable Development Goals and our National Resilience Development Strategy, it is more critical than ever to place social services at the heart of national development. The department's work is directly aligned with global objectives, particularly SDG 1, which calls for an end to poverty in all its forms, and SDG 5.2, which aims to eliminate all forms of violence against women and girls. Through robust interventions in public assistance, child protection, gender equality, rehabilitation, and psychosocial support, we are not only responding to needs, we are building a more resilient, just, and inclusive Dominica. The investments outlined in this year's budget reflect that enduring commitment. Yes, we care, a model of compassionate governance. Let me begin with one of this administration's most visionary and human-centered achievements, the Yes, We Care program. Now in its 16th year of uninterrupted service, Yes, We Care stands as a symbol of what it means to govern with heart. It is a lifeline for hundreds of elderly, vulnerable, and differently able Dominicans, delivering not only care, but dignity. Mr. Speaker, as of May 2025, the Yes We Care program provided in-home care to 156 clients, up from 120 in 2024. 36 new individuals were integrated thanks to this government's unwavering commitment to expanding reach and impact. The program's services, bathing, grooming, meal preparations, medication management, cleaning, laundry, health center visits, are delivered by a cadre of trained, dedicated caregivers whose work reflects the best of Dominican service. Clients also benefited from free first-time water connections, monthly delivery of food, cleaning supplies, gas cylinders, provision of mobility aids like wheelchairs and walkers, new household essentials, washing machines, towels, linen, renovated and repainted homes, improving hygiene and morale. These interventions uplift not just households, but the spirit of those who reside within them. Mr. Speaker, caregiving is sacred work, and it is my observation that not many people nowadays want to give care. So it is sacred work, yet too often it is undervalued. That's why in this fiscal year, the ministry prioritized training for caregivers through in-house health workshops led by our own healthcare training supervisor, 3-week hospital attachment training, international training from visiting professionals in audiology, speech therapy, and physiotherapy, joint sessions with the NEP and Community Hostels, Inc. to standardize documentation, safety, and medical response. And we did not stop there. On International Caregivers Day, we celebrated our staff, not just with words, but with action. And during the month of the elderly, we reaffirmed the worth of every elder under our care. These investments are not luxuries, they are necessities. Because when we care for the caregivers, we ensure that care flows with compassion and consistency. Mr. Speaker, the Dominica Infirmary and Community Hostels, Inc. continue to provide indispensable shelter and care, but the demand is growing. Between 2022 and 2024, Dominica saw a 133% increase in care institutions. Many of these now require regulatory oversight and standardized protocols to ensure safe, consistent care delivery. To this end, this budget includes a 15% increase in subvention to the Dominica Infirmary, technical support to develop national standard operating procedures for all care facilities. These are the early steps towards building a formal, resilient, and well-regulated care economy, a sector that is vital to national well-being. Mr. Speaker, it is time to reimagine care, not as charity, but as productive work. Our vision is the development of a national strategy for the care economy focused on formalizing care work and professionalizing the sector, creating new employment pathways in caregiving, establishing national care standards that ensure quality and accountability. We have initiated consultations with key stakeholders and commenced a review of existing legislation that addresses various aspects of aging in recognition of our steadily growing elderly population. As part of our commitment to proactive planning and public education, the Department of Social Services will host an aging fair in December 2025 in collaboration with partners across the sector. This event will serve as a platform to equip the general public with critical information on aging, retirement planning, and long-term care. It is also intended to encourage or to engage our younger citizens, especially those entering the job market, with tools and knowledge to begin preparing for their retirement well in advance. Mr. Speaker, we believe that aging with dignity requires early action, informed decision-making, and strong systems of support. And this initiative marks an important step in that direction. Mr. Speaker, approximately 1,900 citizens, elderly, disabled, and economically vulnerable, currently benefit from the Public Assistance Program, which provides essential support to the most vulnerable members of society. But we are not satisfied with just delivering support. We are modernizing how we deliver that support, and we are doing it with data and dignity and with speed. Additionally, beyond this essential lifeline, our focus is shifting to systems that promote resilience, efficiency, and dignity. With the valued partnership of the World Food Programme, we are advancing the rollout of SWIMS. By SWIMS, I mean the Social Welfare Information Management System. This shock-responsive platform will significantly improve case management and ensure rapid, data-driven support in times of crisis, such as after natural disasters or economic shocks. As part of our digital transformation efforts, the Ministry will also implement a digital registration and verification system. This initiative will reduce processing delays, eliminate duplication, and strengthen the integrity of benefit distribution. The system will be piloted by January of 2026 and is expected to reduce application processing time by 50%. Importantly, we are transitioning to direct bank transfers for public assistance beneficiaries and recipients of the non-contributory social pension. These digital efforts will be supplemented with our continued revision of the beneficiary list and increased home visits. In addition, through our collaboration with UN Women's Build Back Equal project, we are supporting beneficiaries, especially single mothers, on the road from welfare to work through job training, childcare access, and financial literacy, tools that build long-term economic independence and social mobility. One critical investment under this framework is the continued enhancement of Chances, our transitional home for children who have experienced neglect, abuse, or emotional trauma. In this fiscal year, we will undertake critical upgrades to the facility, including improved safety and comfort features and the expansion of rehabilitation services. A full-time counselor is now stationed at Chances to provide consistent psychosocial support and trauma-informed care. Additionally, we will strengthen monitoring and evaluation mechanisms through enhanced oversight and inspection protocols, ensuring accountability and quality of care. Mr. Speaker, we promised to undertake an independent assessment of Chances following certain allegations, and I can report today that by mid-August, the consultant engaged by UNICEF will begin the assessment. To better support families with young children, particularly those facing economic hardship, we will pilot a new program in collaboration with UN Women. This initiative will target single-parent households with children under 5 years of age. Between August and September 2025, structured cash assistance and case management will be provided to eligible households. This initiative targets both economic vulnerability and child development outcomes, linking families to critical health, education, and social services. It is especially responsive to the realities faced by single mothers and caregivers, many of whom lack strong support networks. Mr. Speaker, through these targeted investments and policy reforms, we are laying the foundation for a stronger, more resilient care infrastructure, one that empowers caregivers, protects the vulnerable, and strengthens our national capacity for care. Mr. Speaker, our government remains steadfast in its commitment to safeguarding the rights, dignity, and future of every child in Dominica. In 2024, we achieved a significant legislative milestone with the passage of the family suite of bills, laying a foundation for solid child protection and welfare. Notably, we also gazetted revised adoption regulations, bringing our legal framework into closer alignment with international child welfare standards. Now in place is a functional adoption committee, and it will ensure robust oversight of all adoption cases, with the best interests of the child remaining paramount. To support effective implementation, SOPs have been developed and coordination, particularly with the judiciary, has been strengthened. These efforts are improving the efficiency, transparency, and compassion of our child placement systems, helping ensure that children in need of permanency receive timely, safe, and loving placements. Looking ahead in the 2025-2026 budget cycle, we will pursue the enactment of the Child Justice Bill, which will further strengthen the legal protection of minors within the justice system. At the same time, we will pilot a restorative justice program a community-centered initiative developed in partnership with civil society. This program will promote healing, reconciliation, and accountability, especially for young offenders and their families. Rehabilitation and reintegration remain at the heart of our strategy to break cycles of crime and marginalization. Through these reforms and new initiatives, we are creating a justice and social service system that is more responsive, humane, and anchored in the values of equity and inclusion. The Department of Social Services, through Gender Affairs, continues to lead national efforts to promote gender equality and prevent gender-based violence. With a renewed focus on confronting issues affecting boys and men, Gender Affairs will also continue to lead gender-responsive planning across government, align with regional and international frameworks, and strengthen systems to protect and empower survivors of violence and discrimination. Mr. Speaker, in advancing this government's commitment to gender equality and the protection of vulnerable groups, the Ministry of Health, Wellness and Social Services, with the support of UN Women and UNFPA, recently undertook critical work to strengthen our national response to gender-based violence, particularly in times of crisis. Mr. Speaker, the Caribbean is facing a dual threat: the escalating impacts of climate change and increasing incidence of gender-based violence. These disproportionately affect women and girls, limiting access to resources and increasing risks of harm during disasters. In response, the government once again is collaborating with UN Women through the Build Back Equal project to adopt the inclusive, resilient, safe and secure spaces model to integrate gender into emergency planning. This includes improving access to safe shelters, mental health support, and coordinated health and justice services. National GBV referral pathways and standard operating procedures are being revised to improve coordination and ensure survivors are treated with dignity, while advanced training is being delivered to health and emergency responders. Mr. Speaker, this is not just a policy achievement. It is a step forward, restoring dignity, strengthening national systems, and removing barriers to empowerment for our women, girls, and all citizens affected by trauma. And of course, Mr. Speaker, we recognize that our young men cannot be left behind. They too rely on us for their protection and support, no matter what the misconceptions about masculinity tell us. In that regard, we will introduce the Youth Mentorship Program, nurturing discipline, leadership, and responsible citizenship through positive role models. We will augment efforts to address school and community bullying through prevention, education, and confidential reporting systems. And we will launch a gender-based violence hotline, improving access to urgent support services, especially in rural areas and underserved communities, and especially for the young men and young boys who would prefer to come to the offices and remain anonymous. Mental health and counseling. Mr. Speaker, no resilient society can exist without strong mental health support. That's why our counseling services are being scaled up with trauma-informed training, outreach to the rural communities, and expanded partnerships with schools and community centers. Mental health is no longer on the margins. It is central to social well-being, and this government will continue to treat it as such. Mr. Speaker, very recently, we had a very successful symposium led by the Department of Social Services, drawing attention to all the factors that can contribute to mental illness and instability. Mental health should be tackled with a holistic approach, and so we engaged panelists from the financial, religious, pharmaceutical, and psychological sectors. But I believe the highlight was the testimonial and lived experience of a well-known radio announcer. His insight was compelling and thought-provoking, and this, Mr. Speaker, will be the first of many such engagements. Mr. Speaker, this budget outlines a vision for Dominica that is deeply humane, fiscally responsible, and socially resilient. Whether we are upgrading chances, modernizing public assistance, training caregivers, or securing justice for our children, we are investing in the kind of society that cares for all. We are building a Dominica where the vulnerable are protected, where opportunity is accessible, and where dignity is non-negotiable. This is not charity. This is nation building. So yes, Mr. Speaker, while others talk about GDP, the success by GDP and roads, we measure it by hope restored, lives uplifted, and dignity preserved. We balance books, yes, but we also balance humanity and development. This is sustainable growth. This is fiscal discipline. And this is what it means to say, yes, we care. Mr. Speaker, as parliamentary representative for the Plaine constituency, I have one mission, and it is to be a voice for the people and a hand in their progress. This budget supports that mission. It brings us closer to housing for all, better roads, empowered youth, and safer, stronger communities. To the people of Plaine, Dalis, and Boutique, I say thank you for your trust and commitment and your love for country. I urge you to take advantage of the many opportunities presented in this budget because they are for you. We value the farmer in Dalis, the fisherman in Scott's Head, the vendor at the market, the teacher in Pebush, the young entrepreneur in Roseau, the hotel staff, the elderly woman in Salisbury, the child at Chances or in Grand Fond, the police officer in Portsmouth, the baker of cassava bread in Kalinago territory, or the medical doctor in St. Joseph, the beautification crew in Plaine. We value everybody. Mr. Speaker, I conclude my presentation today by saying this budget is not just a financial instrument. It is a moral declaration of who we are and what we stand for. Let this honorable House and all of Dominica know we are building a country where development is felt in every home, on every farm, in every classroom, and in every community. So, Mr. Speaker, I urge this honorable House, let us support the budget, not only with our vote, but with our vision, with our voice, and with our vigilance. May God bless our people, the wonderful constituency of Plaine, and our beloved Nature Isle.
Very good.
I support the budget.
Yes, I recognize the Honorable Minister of Finance. I think he wants to adjourn the House or suspend. But I wanted to just point out something before we suspend the House. I mentioned it this morning, but I think it is important. It will take a little time, maybe 5 minutes, but I think it is rather critical. First of all, I spoke to an honorable member of the House earlier this morning to point out to the member that, and now that statement I'm going to make is for other members also, but for members of the House, strangers, everyone, that we have to maintain a level of decorum when we come into the House. Members cannot forget to bow to the chair. We, especially when we are late, sometimes we rushing in and we forget. I see a lot of members remember, most of the members, but the particular member, the member seemed to always forget. So I pointed it out to her, but I'm not going to call the member's name there this morning. So another matter I wanted to deal with, but I wanted the debate to start, so I didn't say it in announcement. But before I go, I would like to clearly indicate to members or remind members that the Parliament is the lawmaking body of the Commonwealth of Dominica, and therefore the expectation should not, or members' expectation in regards to ruling should not be based on their emotion or what they think. It is based on the standing orders. Standing orders. No opinion of what you think it should be. No, it's a law, so it's based on the standing orders. And to that, in order to avoid us going down a slippery slope in regards to the use of displays, exhibits, and props as part of a member's contribution to the debate, I would like to point out the following standing orders and then make a final ruling on the matter. Because even when you make a ruling, members still want to engage you out of the chamber. So let me just, it's not based on my emotion, it's based on the rules. So, ruling 41-8. I mentioned it, but I'll just read it again. So I want to explain my basis. 41-8 says, a member shall not read his speech, and it says, except with the leave of the speaker or the chairman, but he may read extracts from written or printed papers in support of his argument, and any may refresh his memory by reference to his notes. But I'm not going to touch on the reading issue. We'll deal with that separately, privately. But so let us focus on what I'm talking about. That is one. Standing Order 87. 87:1 says, in any matter not herein provided for, result shall be had to the usage and practice of the Common House of Parliament of Great Britain and Northern Ireland, which shall follow as far as the same may be applicable to the House, and not inconsistent with these standing orders, nor with the practice of the House. So if there is no precedence and it's still not in regards to the standing order, we have to go to England. And then the second one here, we'll talk about Erskine Maynard. The second part says, in cases of doubt, the standing orders of the House shall be interpreted in light of the relevant usage and practice of the House of Commons, but no restrictions which the House of Commons has introduced by standing order shall be deemed to extend to this House or its ministers until the House has provided by standing order for such restrictions. Let's go. Now, having said that, remember I said that if you realize none of the standing orders I read have mentioned things like exhibit and display and all that. None. Then I remind members in all that context, the English Parliament in terms of the formal part where it involved the town and the countryside and all members to form the parliament and not just the lords. That was established in 1265. That is 760 years ago. And that's what we're following if we don't have it in our standing order. Having said that, I said, okay, let's just touch base on a document, a House of Commons Procedure and Practice, edition 2009. And the section there on page 612, hear what it says. Under this, it have a headline, displays, exhibits, and props. Speakers have consistently ruled out of order displays or demonstration of any kind used by members to illustrate their remarks or emphasize their positions. Similarly, props of any kind used as a way of making a silent comment on issues have always been found unacceptable in the chamber. Members may hold notes in their hands, but they will be interrupted and reprimanded by the speaker if they use papers, documents, and other objects to illustrate their remarks. Exhibits have also been ruled inadmissible. During a flag debate in 1964, the speaker had to remind members on numerous occasions that the display of competing flag designs was not permissible. Small Canadian flags and death flags have been disallowed when they have been used to cause disorder in the House for the purpose of interrupting a member's speech. While political buttons, like I see some people have, and the pins have not been considered exhibit as long as they do not cause disorder. Let me just read there's a short one again. Just a little on one document in regards to practice, parliamentary practice in New Zealand, a Commonwealth country also. I'll just read one line, and that is on page, actually it says, that is on the visual aids. It says, it is not permissible for another member to stand next to another, speaking, holding something up. The size of the object used will also be a consideration. The speaker will not permit a demonstration to be staged in the chamber. So if we start allowing people to start bringing their postcard or their big flip chart, and it's going on all sides, PowerPoint, etc., then instead, remember, the parliament or the word parliament means parley. It didn't mean Lee in Creole or French mean to read. It didn't mean that. It's a parley. So when we start arguing about bringing podiums to use laptops, that's why we're moving away from parley now to Lee. Let's read. So let's move. Okay, almost done. So having read that, the different sections, it doesn't mean that, and I would say, one of them, the last one I'll read, that's in the House of Representative Practice, second edition, Australia, page 481. The chair has been of the opinion that unless a matter in question had some relation to dishonesty or against the standing orders, the chair was not in a position to act, but hoped that members would use judgment and responsibility in their action. So again, if something is not unparliamentary, like the Honorable Deputy Speaker showed something, a picture, just one chat, a picture, nothing unparliamentary, it was to big up somebody. That was allowed, no problem. So let's move now to conclusion. In what I've read, and even in the standing order specifically, there is no mention of flip chart, PowerPoints, posters in the standing orders. There is no precedence from since 1978 in which this Honorable House allowed the Minister of Finance to use PowerPoint, flip chart, other things to strengthen his argument. He had to use words. Parley, but with the exception that it is allowed that he reads because there are numbers, there are different things that you do not want the Minister of Finance to make a mistake on. So it is allowed. But even when you follow from since 1978-79, before the opposition members didn't even used to have written, they'll just stand up and respond. But now time change. Now we have AI. So you could run an AI. The AI program could now write a speech for you, or a stranger could write a speech for a member and the member could just come and read it. And the intention was never that a stranger is allowed to debate. Yeah, you say it's true, but maybe sometimes you could maybe be getting strangers to write for you. But so let me complete the point. So having said that, my ruling is that I'm ruling that this will not be allowed in the future unless members of Parliament through the Standing Orders Committee agree to give guidelines, clear guidelines in the standing order for us to allow it. We have to go based on the rules. If we find we want people to come with PowerPoint and start doing flip chart and all that, it have to be in the rules. But I'm not referring to if a member is showing a page or a member is showing, like you flip a chart or a picture. No, I'm not referring to that. And in the actual extracts, it even points out where the speaker need to give permission depending on the size. So members, I've been there for over 10 years now in this honorable house. But I do not want, as I always tell members, when you come to this honorable house, you should come to enjoy it. But I don't want to be the chair, the speaker of the house, but I'm not enjoying it because members are moving away from the standing order and want to do what they want when we have the standing orders. Let's make the standing orders guide us so then it can be fair and balanced. Because every time we open a way for ourselves, we open a way for everybody else. And then I must be balanced and fair. Because I'm just passing, as they say in life. So when I leave and somebody read the Hansard, because if you go back to the Hansard, when I was in the opposition and in government side as a member, elected member of Parliament, you'll see that I never ever disagreed or end up in a combative action with the speaker on her ruling. You might see me in a banter with members, but not with the speaker. I remember the Attorney General here used to ask the speaker, but speaker, how comes you love him so much? You allow him to do everything. So let's just follow the rules so all of us can enjoy it. You know, so that's what I wanted to say in regards to that matter, because I only brought it up because apart from the ruling yesterday, members are actually meeting me out of the chamber to engage me. Members, when you rule, but members are not satisfied, so they actually engage in you on the ruling. So I had to take some time to deal with it. You understand? Because I was given a job to run this honorable house, preside over matters. So please allow me to do the job that you voted me in to do. Because I will always be objective. I will always do it without fear or favor. That's what you put me there to do. Not to try to interpret things on my own without the rules. It's the rules. If you don't like the rules, change the rules. Thank you. Honorable Minister.
Speaker, I move that the House be suspended until 3:15 this afternoon.
Seconded, Mr. Speaker.
Yeah. It has been moved and seconded that the House be suspended until 3 p.m. this afternoon. 3:15 p.m. this afternoon. Those in favor? Those against? The ayes have it. House stands suspended until 3:15 p.m. this afternoon.